You want to start again?
No. I was just asking, but
You want to start again?
No, I'm not studying.
You know the one who is going to be having issues. Possibly is not even going to connect. You and the premier know. You and the premier know.
Leave it there.
Yeah.
Don't go further.
You and
This
the
meeting
premier know of who.
This sitting will be disrupted.
We shall leave it at that.
Okay, sure.
Kumalo and Msimang. Kumalo and Msimang, we are out of order.
We didn't mention any names, boss.
Morning, Chairperson.
How are you?
Simang wearing pants.
I'm fine, how are you?
Can Simang stand up? We want to see if he's wearing pants.
Short pants. Wearing short pants.
Listen for order.
You can't be coming to a
Simang, you are making noise.
You can't be coming to a sitting when I'm wearing tracksuit like you're going to vigilantes.
Yes.
Simang, you are making noise.
Joe, when I take off that head of yours, take off that caps of yours. This is not your stadium here.
It's winter, and I know that I dress well.
It's unparliamentary, man.
You can see I'm very sleazy.
We can't see you.
We can't see you.
You can see me.
No, we can't.
Come in. I
can't see you.
I'm
colleagues, let me remind you. Joe.
Yes.
Let me remind you, we're not sitting in a members' lounge at this moment. There's people also from outside who are watching this and listening. So let's just be orderly. Thank you. We are Mamela and Tomofun.
Madam Simang, which mayor said you are a big head? She's the mayor of
Big headed stupid ideas.
I shall not comment. I'll deal with you after this.
Was that mayor speaking in his official capacity or what, Madam Simang? I just want to know.
When we meet at the Swallows boardroom, I'll tell you.
Good morning, my dear friend. Are you well?
I'm very well, how are you, my brother?
Thank you so much. Brother John. Hey, Brother John.
Yes, big man. How's it?
Are you well?
I'm always well, thanks, and you?
That's good.
I'm battling to change my background. I don't know.
Yeah,
you must ask your daughter to do that, John.
There's that list of instructions.
Follow that. In the background.
No, it's about 2020.
No, man, listen a little more.
Thank you, colleagues. Thank you. Good morning, all.
Morning, Madam Speaker.
The Speaker.
Sorry, close your mic. Close your mic. You're not the speaker.
Okay.
Thank you. We may all be seated. Thank you. Colleagues, thank you very much, honorable members. I wish to officially declare the meeting open and welcome our honorable premier, members of the provincial legislature, the members of the executive council, the leaders of political parties, the chief whip, our officials from the executive, including officials from the society to ensure that they stick to the rules. But thank you very much. We also want to acknowledge the work that has been done by the executive in terms of ensuring that the people of Gauteng are safe, but also we respond positively in order to keep down the COVID-19. Thank you very much. Let me indicate to all members that you will know that these virtual rules were adopted when the House was not sitting. In terms of Rule 36, we need to actually adopt the rules. Let me read the rules. The Speaker may, in consultation with the leaders of political parties, settle certain matters, including but not limited to the adoption of the final mandate. In the absence of the consensus, the matter must be dealt with by the House sitting. Any such matter settled in terms of this rule must be ratified by the House at the first available opportunity. All decisions taken in accordance with this rule shall have full effect of the House resolution. The Speaker must, at the next sitting, announce information on the resolution adopted in terms of this rule. I therefore announce the rules. Honorable members, am I audible enough?
You cut out for the last 30
No,
seconds.
Speaker, we didn't hear you.
I said I'm presenting the rules. I'm presenting the virtual rules in terms of Rule 36 of our standing orders. Can I get a seconder for the adoption?
Member Adams, a second.
Honorable Moriarty moving, Honorable Adams seconding. Thank you very much. Any other announcement from members?
Yes.
Madam Speaker, we are struggling to hear
I have
you.
an announcement to make from the EFF.
Announcement. The announcement can be made by the EFF, but it can be made by a member. So, Honorable Chitangano, I take it.
I'm saying I'm having an announcement, Speaker. It's Member Chitangano.
Honorable Chitangano, can I request that if you want to speak, there's a hand in your toolbar. Click that hand, I will recognize you, because if you speak, you are disturbing the audio. Honorable Chitangano?
No. Thank you, Speaker. The EFF, as of yesterday, became #1 highest payroll giving donor to Solidarity Fund, which continue to demonstrate that we are indeed a leader in society, and we will also urge other political organizations and formations to follow suit. Indeed, EF leads and others follow. Thank you.
Unfortunately, that is not an announcement. If there are no announcement, we have not received any apology from any party. I will take it that all members of the legislature are present in the meeting. Can we therefore go to an item, the member statement? starting with Honorable, or before the member statement, there's a motion without notice. Honorable Chief Whip.
Thank you very much, Madam Speaker, and good morning, colleagues. I, Honorable Member M. Kumalo, ANC Chief Whip, hereby tables the motion in terms of Rule 120, subsection 1 as follows, noting that the Programming Committee meeting discussed and agreed on the 27th of April 2020 to add the Division of Revenue Amendment Bill 2020 to the orders of the House sitting scheduled for 19 May 2020. However, the committee report on the final mandate of the bill will only be ready after the 22nd May. Therefore, request that the House resolve 1, to remove the above bill, Division of Revenue Amendment Bill 2020 from the sitting of today, 19 May 2020. I so move. Thank you very much, Madam Speaker.
Madam Speaker.
You don't shout. There's a hand there. Please press the hand if you want to speak. I've noted.
I'm sorry, I am looking for it.
Honorable Moriarty. Okay, colleagues, can I request that all members, if you are not speaking, switch off your video. Can you also, if you're not speaking, switch off your mic, because it will be difficult for all of us to hear each other if that's how we're going to be running the meeting. But I will request members, just check those 3 smaller buttons in your toolbar. When you click in the 3 buttons there, there's going to be some instruction. The instructions will indicate that you have the hand if it's not appearing in the toolbar. Okay. Honorable Moriarty?
I second the motion, Madam Speaker.
Speaker.
Oh, I now put a question. All those in favor say yes.
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 Yes. Yes. Yes. Yes.
Yeah.
Speaker, sorry, I don't have a hand bar here, but I need to make an.
Yes, Madam Speaker.
Thank you. All those not in favor say no. The yes have it. The motion is adopted by the House. I see Honorable Mateke. I'm not sure why are you raising the hand at the stage. Can I allow you to speak?
Yes.
No, Honorable Speaker, my hand was up during the process of the adoption of the rules. Thank you.
Madam Speaker,
Okay,
sorry, I don't find the hand.
It off. In the 3, you don't find the hand in the toolbar. Just move your cursor. If you can't, can you move it to the check the 3 buttons and their instructions? If you click on the 3 buttons.
I'm there, but I don't see anything. It looked like a hand. Sorry, I just want to say that we weren't informed of the programming committee meeting, and I make objection about that. Can it be noted, please?
In terms of Rule 81, can I request Honorable Ntsekhe to make a member statement?
Thank you, Honourable Speaker. The manner that the Gauteng Department of Social Development is handling the distribution of food parcels is deeply concerning. There are many people who applied in March and April and have still not received food. Whilst I'm worried about COVID-19, my biggest fear is that many Gauteng residents will die of hunger. Some people have been waiting since March for food parcels. It is also concerning that NGOs are being blocked from feeding cooked food. This is the time when the department should be embracing NGOs and making it easier for all NGOs to assist. There is no logic in asking homeless people to be given food parcels. NGOs need clarity on which regulations are enforced to stop NGOs from distributing cooked food and when these were gazetted. Further, the department we submit should really fast-track other methods of getting food relief to residents, such as food parcels, e-wallet, and money transfers. I thank you, Honorable Speaker.
Thank you, Honorable Katebe.
The EFF is noting the interventions put in place by the Gauteng Department of Health with regards to the measures to capacitate healthcare facilities in response not only to healthcare in general, but also to an outbreak of COVID-19. We have a strong belief that all these measures and intervention will not come cheap, especially after the department, together with the entire Gauteng provincial government, had sourced temporary field healthcare facilities at Nasrec Expo Center, Kopanong, and FNB Stadium to accommodate COVID-19 patients. We further noted that in 1996, the Gauteng provincial government shut down the Captain Park Hospital in Ekurhuleni without a clear explanation to date. This hospital is costing the Gauteng provincial government millions of rands in terms of security arrangements to avoid vandalism of state property. The equipment is still in good order and has more than 340 beds. We are concerned that nothing is said to renovate and repair this hospital, and the department is spending millions in temporary field hospital. For cost containment measures, it will make perfect and logical sense to refurbish and reopen this hospital with agency. This will relieve the pressure on both the Edenvale and Tembisa Hospital. Thank you.
It looks like we've lost Madam Speaker. Perhaps Honourable Manamela must assume the chair.
Is anybody ascertaining where the speaker is?
We're doing exactly that.
I'm taking over here. There's no vacuum.
Well, no, we're joking. We're not joking. It's a serious meeting. I think there's a network connection.
But can we respect the sitting of the legislature as well?
Good morning.
Morning.
Morning,
Good morning. Yes, can you continue? The member statement has been noted. Can I then move to other member statements? I don't have the list of members that want to make statements. Whilst I'm checking the list, can I then allow the next member to make his or her member statement?
Thank you, Dad. Thank you, churches. Churches.
Yes,
I want to make a statement with regard to COVID-19.
Okay, you are recognized, Honorable Member Mpisi.
Yes, thank you very much, Chair of Chairs. I want to thank the leadership of Gauteng, led by the Premier, Honorable David Makura, with the response they've had as the command team of Gauteng, and especially thank the MSC for Community Safety, Honorable Mazibuko, for the work well done over the weekend when we reported a company that had patients or people who were COVID positive, but they were allowed to work in one of the companies in Midrand. And we want to thank all the inspectors and the police that accompanied the MEC to make sure that that company is closed and things are followed properly. The health protocol processes are followed properly. And we want to thank you for the job well done. Thank you very much.
Thank you very much, Honorable Member Mpisi. On my agenda, I think we're finished the member statements. We'll then have to move to the Premier's question time. And can I then request that Member Msimang start to maybe request Member Msimang to start asking his questions.
Can members switch off their mic, please? They are making noise.
Thank you.
Yes.
As far the screen.
All right,
as far like you did.
Mazibo, can you switch off your camera? Member Mazibugo, switch off your camera, please.
Also mute, Madam Chair of Chair. We don't want to hear what they are saying.
Thank you very much, Madam Chair of Chairs. Once again, good morning, colleagues. To the Premier, with regards to the Gauteng provincial government's response to the COVID-19 outbreak, could the Premier please indicate, one, the details as how each department has been instructed to assist efforts in fighting against the COVID-19? Two, when will each department submit
Member, Honorable Premier.
Hello, ma'am.
I've lost you, Honorable Msimang.
Am I audible, ma'am? There was just a bit of a lapse there. I don't know what happened. Can I continue the question?
Yes, please. Please continue.
Thank you. Number two, when will each department submit its revised plans in this regard? Madam Speaker, there's somebody who's really just annoying now because there's somebody who's busy pressing on the mute button. I don't know what it is, who it is, but there's somebody who's manipulating the system here. Can I please ask that whoever is the anchor, just make sure that there's nobody who's manipulating the system, because now they keep switching us off here.
We'll ask the ICT to deal with those people because they keep on disturbing. Colleagues, we were disturbing us. Can we ask ICT to stop those members from doing so? Continue, Honorable Msimanga.
Thank you, ma'am.
That was as well. What happened?
Number two, when will each department submit its revised plans in this regard? Number three, what percentage of each department's budget, and please provide the amounts in rands and cents, will be directed to fighting COVID-19? And number four, what impact will each have on each department's ability to continue providing services in the 2021 financial year? And lastly, what system, if any, has been established to monitor and track the performance of the departments in relation to its new business plans to fight COVID-19? Thank you very much, Madam Speaker.
Thank you, Honorable Premier.
Thank you very much, Madam Speaker, Deputy Speaker, the Chair of Chairs who took over immediately after there was some interruption there, the Chief Whip and the leaders of the political parties represented in our legislature, honorable members. This is the first time we meet since our country entered this very, very difficult period. So in answering the two questions, Honorable Simanga's question and Honorable Paladi Dikhamela, I will take the opportunity to also share with you as briefly as possible the work that our provincial government has done, working with various sectors in our province. Thank you for the opportunity to share this with you through the questions so that we can account to this House. We have been doing work as part of our country's nationwide response to the outbreak of the COVID-19 pandemic. I will summarize firstly the strategy of our provincial government and whole of government work, as well as the structures and the process of allocating resources, and then deal with how the various departments are responding to this. Members would know that what's called patient zero, the first case was on the 5th of March in our country. And between the 5th of March and the 27th of March, Gauteng province was the epicenter of COVID-19 in South Africa. And more than 50% of all the confirmed cases were in our province. It is important to understand how we responded as more cases were coming in, particularly through what's called importation of cases through air travel, through international airport or terminal. So our province adopted a strategy based on 6 pillars. So our response plan was guided by the National Command Council, but we adopted a strategy based on 6 pillars. Firstly, we focused on how we gear our whole healthcare system to respond, what we call the comprehensive health response. And secondly, we focused on how we address food security and social relief as a result of the impact, particularly of the lockdown. And thirdly, we focused on enforcing all the health measures that were stipulated in the health response, especially by the World Health Organization. Social distancing is one of them, sanitization, and all the related measures, as well as the regulations that were published by the National Command Council. And the fourth area, we focused on the economy, how we mitigate the impact, especially of the lockdown on some sections of the population and businesses. And the fifth area of our focus, which is the pillar of our strategy, we worked with various areas, what we call social mobilization, outside government, work with various sectors to respond to the pressures, including on issues of food security, to support those who are vulnerable and mobilize more solidarity. And lastly, the last area of our response, Honorable Msimang, was to also gear up the whole state machinery, the provincial government, to operate under new conditions and begin to organize this along what is known now as the new normal, so that the government itself must be agile and has the capacity to respond. So those were the 6 pillars of our work. And then we put in place structures. The Provincial Command Council was the apex of that, bringing all the departments in the province and municipalities together. The Command Council is chaired by myself as the Premier. It used to meet in the early phases every day. Every evening, the Command Council would meet, especially When the outbreak was really, really hitting our province hard, we were meeting every evening. And then later we restructured our meetings. We now meet twice a week as the Command Council. But the Command Council is supported by the War Room at the Command Center, which is an administrative structure with all senior officials, including from national government departments that are critical, including correctional services. As part of those national government departments, the army, the police. So the War Room meets every day to look at the situation every day, receive reports on each area of work, on health, on new cases, on what needs to be done on that, on food security, what needs to be done to address the emerging problems, the emerging needs, but also on enforcement and compliance, where are the problems, what needs to be done about that, on the issues of the economy, whether there are issues that we are adequately responding to, and on issues being raised by various sectors. So that's at the provincial level. At a district level, the structures that are there is the District Command Council chaired by mayors, again bringing the local municipalities, but provincial and national departments in each metro or district, again to emphasize what we call the GCR-wide and the whole of government response. So your question deals specifically with the departments at the provincial level, Honorable Msimanga. But I want to emphasize that our response has been the whole of government GCR-wide. Yes, we look at what the provincial government departments do, but we also work to ensure that every municipality is organized appropriately, and all the municipalities in a district are also structured along responding to the issues pertaining to the health response, to food security issues, to law enforcement and compliance, to the economy, to social mobilization. And the municipalities themselves are also responding to the emerging needs and threats around COVID-19. Yes, provincial government departments have all been working on the same plan, around this plan, around the 6 pillars. And our municipalities have also been working in a very coordinated way. In the first phase of the outbreak of the pandemic, and by first phase we mean between the 5th, patient 0 in Gauteng was on the 7th, whereas patient 0 nationally was on the 5th. So from between the 7th of March and the lockdown on the 27th, that's what we call the first phase. During that first phase, we were working generally just chasing cases, testing, tracing contacts, making sure people are isolated or quarantined, self-quarantined, because most of those people in that period, most of the people who were positive in that period in Gauteng were in the suburbs. Most of them could self-quarantine and self-isolate. But we learned very important lessons in that period. I want to add in our response, Honorable Msimang, that we also had extensive engagements with various sector leaders, including political parties, the leaders of political parties in our own legislature, religious leaders, business leaders, and various civil society groups. And we all worked together. I must say, Madam Speaker, that we have never worked together the way we have in the past 2 months. We all worked together, and if Gauteng in the past 2 months since the outbreak, if some of our work is appearing to yield results, it is the result, the collective result of all the efforts that we put together. So I want, as I respond to this question, I would like to thank all leaders of political parties in our legislature for their cooperation over the past 2 months. And in particular, I want to mention Honorable Khumalo, the Chief Whip of the ANC, and Honorable Magagula, the Deputy Chief Whip of the ANC, Honorable Msimanga, the leader of of the Democratic Alliance, Honorable Mukwebo, the leader of the Economic Freedom Fighters, Honorable Albert, the leader of the Freedom Front Plus, Honorable Adams, the bishop in our team. Every time we meet, he always prays for us. And Honorable Dlamini, the leader of the IFP. I want to thank them in this house because they have really been our pillar of strength. In addition to many members in the house from wherever you are who have been working together, bringing to our attention problems with food, problems with all the issues that we had to respond to. It is now evident, and it's evident because the evidence bears it out, that our province has been able to slow down the infection rate, particularly during the lockdown. It is also evident, and the numbers bear it out, that in the top 4 provinces with the highest number of confirmed cases, and those top 4 provinces is the Western Cape, is Gauteng, is the Eastern Cape, and KZN. It is evident that we have been able to slow down the rate of transmission more effectively. Of course, the Free State used to be in that list early on, but the Free State has almost, in terms of performance, it has done much better than the 4 of us, but our province has done pretty well. Our province has moved from a position of having 50% of confirmed cases, and at the moment we have less than 15% of the confirmed cases in our province. If you look just at the active cases, because there's a difference between confirmed cases and active cases. Confirmed cases is all cases that have ever been reported. Active cases is only those where people are still positive, minus the recoveries. Our province now has much less active cases, 15%, and it has fewer, 10% of the national active cases, and 15% of the confirmed cases. I also want to report to you that we have the highest recovery rate amongst those top 4 provinces that are COVID hotspots. Our recovery rate over the past 3 weeks is above the range. It's averaging 70%. We continue to be a province also that has tested the largest number of people. Of course, the Western Cape has tested more per capita, but we have the largest number of tests done in the Republic. 33% of those tests in the Republic have been done in Gauteng, 21% in the Western Cape, and 18% in KwaZulu-Natal. We have screened more than 4 million people. We also are a province with the lowest, in the top 4 provinces that are COVID hotspots, we are a province with the lowest mortality rate of 1.1%. So yes, indeed, we have lost 26 people. May their souls rest in peace. And may we convey our condolences once more to the bereaved families and pray that God comforts them and heal their wounds. 26 people is 26 too many, but that is still the lowest in the top 4 provinces in terms of mortality. We also have a very low admission in our hospitals, admission rate. Per week, we often have between 48 and 72 people. We have even fewer in ICU. Often we have 4 to 8 people in ICU. And the number of people in ICU is a very important indicator of where death is going to come from. Provinces that have more death have larger numbers of people in ICU, and particularly who are on ventilators. Honorable members, I would like to call on you, honorable members, to join us in thanking our healthcare workers for their dedication professionalism and sacrifices. They have really been fantastic. They have gone out there to work very hard. I want to say to you, Honorable Msimanga, that with regard to the specific departmental plans, each department and agency of our province is busy finalizing a review of their APPs. So they have their business plans on COVID-19, which have been approved by the War Room and the Command Council, but now they are reviewing their APPs because COVID-19 has had a huge impact on this. We are also reviewing all the budgets of departments, and we will come to the legislature in June after the national minister has passed the adjustment budget to bring an adjustment budget to the legislature for approval. We have also gone to every department to put in place what we call a government business continuity plan in order to look beyond COVID. Yes, in the current phase of COVID, but beyond COVID, how is GGT 2030 going to be affected? How are our plans going to be affected over the next three to 4 years? So we are finalizing that. By the end of May, these plans will be finalized, Honorable Msimanga. By mid-June, we will have a budget that is approved. And we would like by the end of July, depending on whether there's not end of July, end of June, Madam Speaker, that we can bring revised APPs end of June. Bring revised APPs. That's one of the questions of Honorable Msimanga. So, honorable members, I think although so far our province has slowed the curve, our municipalities and provincial departments and working with national government departments have been able to coordinate well. I need to say that all models and scenarios are projecting that the road ahead is going to be tough and it is going to be painful. So the past 2 months' successes are not the be all and end all, and we must not be complacent. We are not over the hill. We still have to climb the mountain of the peak. The peak is still ahead of us. It may come in July, it may come in August, it may come in September. Various modeling scenarios are indicating that it is still coming, and it may come in several waves. We may even still be in this until 2021, mid-2021 to 2022. Some are saying 18 months, others are even saying 2 years. COVID-19 will still be with us. Why am I saying this? Whereas we are confident that the national lockdown has helped us to prepare for the peak, we must not think that it is done and dusted. So I want to say to this House that as the provincial government working with municipalities and various national agencies operating in Gauteng, we are ready for the worst of times. We will continue to build capacity for that worst of time so that if the peak finds us anytime, we should be ready. We are getting ready in expanding the capacity of our health services, employing more health workers, building more infrastructure. And I know the honorable member from the EFF who's talking about Kempton Park. The Kempton Park is something we have been looking at, the old Kempton Park Hospital. We have been looking at that with the MEC about what can be done in the shortest space of time. We are looking at everything everywhere, and our approach is that we are not putting more resources in temporary structures. We want to put more resources in our existing infrastructure and upgrade more of this. So we will come back on the budget. We will come back on the APPs, Honorable Speaker and Honorable Msimang. But we thank you all for this. Let's work together, even ahead of this time, in the most difficult time ahead. I think if we work the way we have worked together, even with the leaders of political parties, we will ride through the eye of the storm. And indeed, the storm is still coming. Thank you, Honorable Speaker.
Thank you, Honorable Premier. Honorable Msimango, do you have a supplementary question or comments?
Yes, ma'am, I do. Thank you very much. Premier, thank you very much for that response. I must say that I feel a little bit better that we are revisiting the idea or the issue of the APPs, which is very much important in terms of how we deal with the pandemic going forward from a government perspective. I think one, Premier, I would want to ask that, the APPs be put on the website. Once we do have those documents ready, that those be put on the website, and also we be notified as such of the ATCs when these are ready. Let them be known by everybody in terms of what is happening. But also, Premier, my worry is that we are talking about moving to level 3. And the reason why, we are pushing to move towards level 3 is because there's an economic hemorrhage that is taking place in Gauteng and in South Africa. And you know that Gauteng is the heartbeat of the economic heartbeat of South Africa. And therefore, it is important that we lead in terms of, injecting and re-energizing the economy of South Africa, but starting here in Gauteng. I think the government will have a critical role to play in terms of stimulating the economy once more, Premier. And this is why I was asking in terms of how much we are going to be spending, because our spending should somehow be focused at also becoming a stimulus of getting the economy going. And therefore, I think it will be important for you to then take the House into your confidence and the people of Gauteng into your confidence in telling them how you are intending on ensuring that there is a stimulus package that is going to be here in Gauteng. More specifically, how do we ensure that it starts within the departments themselves and how they're going to be spending going forward? Thank you very much, Madam Speaker.
I see Honorable Mbisi.
Thank you very much, Speaker. Just a follow-up question as well, Premier. In terms of we know that as Gauteng, we are more worried about making sure that we save a lot of lives of our people. But one of the important matters that I think we also need to look at, I think, is the issue of the jobs that we're currently going to lose in our province. What is the Premier and the team going to do to make sure that we do not lose as many jobs as other people anticipate, particularly the analysts in our province, so that we make sure that our economy is strengthened, but the life of our people comes first. We can't put profit first before the economy. We must put our people first so that they can be able to work. Thank you very much, Speaker.
Honorable Tagile.
Speaker, I just wanted to get an understanding from the Premier on the dynamics of this coronavirus as it relates to question of class and also of race. What the dynamics are involved in that regard versus the township and the suburbs? What comparative are developing in that regard? Thanks, Speaker.
Honorable Premier.
Thank you very much, Madam Speaker. All the three questions, including the follow-up question by Honorable Msimang on the economy and Honorable Mbisi and Honorable Dakile, are part of my response to Dr. Dikhamela's question, which is the next question. So if you don't mind, Honorable Speaker, so I'll say something specifically there on the economy, because her question deals with the economy, and the dimension, the issue of jobs, and the dimension on race, class, and gender. I'll say something there. So I'm not avoiding this, but I'll deal with them when I respond to Dr. Dikhamela's question. Is that okay, Madam Speaker?
Madam Chair of Chairs, you need to come back. The speaker has gone again.
Premier, I think that's okay. We'll actually consider that response when you respond to Dr. Dikhamela. Is the speaker still not back?
Yeah, she's not back, Madam Chair of Chairs, so maybe.
But this thing is not working.
Okay. Can we then
Why are
move
we
to then?
Watch.
So, Member Msima?
Hello, ma.
You are through with your comments, isn't it?
Yes, I've given my submission, my second bite. The Premier was going to respond,
Okay.
but he
Thank you
says
very
he'll
much.
respond when we answer to the second question.
Okay, the honorable Premier have actually indicated that he'll respond to some of the questions when he responds to Member Dikhamela. Can I then request Member Dikhamela to ask her questions, please?
Good morning, Honorable Chair of Chairs. My question is with regard to COVID-19. Can the Premier please indicate what is the impact of COVID-19 to health as well as to economy in Gauteng? Thank you very much, Honorable Chair of Chairs.
Very much, Honorable Member Dikhamela. Can I then request the Premier to respond to the questions by Dr. Dikhamela, please? Thank you, Premier.
Thank you very much, Madam Chair of Chairs. Thank you, Dr. Dikhamela, for the question. I think the one thing I forgot to reassure Honorable Msimanga about is that, yes, the revised APPs will be put on the website. Dr. Dikhamela, your question about the impact of COVID-19, part of that question has been answered when I was responding to the question of Honorable Msimang on our province. The point I have made earlier on is that if you look at where we were in March between the patient zero, that's the 5th of March, patient zero nationally, or patient zero in the province, that's the 7th of March. If you look at where we were between the 5th of March or the 7th of March and the 27th of March, in that period, the graph was shooting the roof. The number of cases, there were fires all over, particularly in Johannesburg, in the core areas in Johannesburg of Sandton, Four Ways, in Ekurhuleni, in the core areas of Bedfordview, Kempton Park or Artambo, in Tshwane, in the core areas of the CBD of Tshwane and Centurion. The number of cases there which were increasing per day, in that period we had the average of 42 cases per day in terms of the rate of infections. And we basically saw that after the national lockdown, the reason we keep saying that the lockdown has worked for us in Gauteng, whatever the politics anywhere else, The lockdown has worked for us in Gauteng. We keep saying we have evidence because after the lockdown, the number of cases per day shot down. The graph was declining quite rapidly. And our modelers and data scientists are showing that we have been able to have a much fewer cases. So the impact is still severe if you think from a health perspective. Yes, we now have 2,334 cases, more or less. The impact has been severe on the psychology of people. We have had 26 deaths. Yes, the positive side of it is that we have had 1,700 and a couple of cases that people who have recovered. But the impact has been severe on health in that sense, but our healthcare system has not been overwhelmed. And our health system responded well from the point of view of our health workers and tracing teams. And that's why we are jacking it up. But on the health side, we are not yet where we can't say that the impact has been too bad, because it's only if we think of going forward, if the peak comes in end of June, July, August, we will be much readier than if it had come much earlier. We would be in the situation that you have seen elsewhere in the world. In Europe, some of the European countries and some of the North American and Central American countries and South American countries as well. Yes, the impact on health, it has been negative, but it has been less so because we are in a better position, as we could show with the numbers. But there's no doubt, Dr. Dikhamela, that COVID-19 is the biggest public health emergency and a global economic disaster that can only be compared with regard to public health. We can only compare anything of the scale of this was only the Spanish flu in 1918. Yet we know the Spanish flu killed 50 million people. There's no model that says COVID-19 will kill 50 million people in the world. Not even the worst case scenario says that. The Spanish flu infected 500 million people. That's 1/3 of the global population at that time. There's no model that says 1/3 of the global population now, 7.7 billion people is the global population. No model says 1/3 of the global population will be affected. But it's still a global pandemic of unprecedented proportions, at least since the 1918 Spanish flu. In economic terms, the impact of COVID-19 is something that will have the scale of the economic disaster would be like the 1929 Great Depression. That's so are economists saying. Economists are saying it will be bigger than the 1998 financial crisis that started in Asia. It will be bigger than the 2009 economic crisis, that it will be bigger than the recent crisis we have had, the global slowdown we have had. Those were recessions, but this one in economic terms is going to be a depression. Now, there's a big difference between a recession and a depression. An economic depression, we have only had one economic depression in this century, in the last century. It was the 1929 Great Depression. Now, we know depressions destroy economies, they destroy livelihoods, they destroy businesses, they destroy pension funds, investments of ordinary working people, they destroy literally investments that ordinary working people and businesses would have made over many, many years. So, yes, every scenario says that COVID-19 on the economy would be no less than of the scale of the 1929 depression, the Great Depression. So I think this is something very, very, very serious. We already see in economic terms, in the US, in a sense, the biggest economy in the world, we see more than 15 million people have lost their jobs. They are now queuing for social interventions, insurance, unemployment insurances. And in many parts of the world, in terms of food security, we even see in the developed economies, you see that in Switzerland, you see that even in the Scandinavian countries that have better healthcare systems and better social security systems. It has also had a huge impact on just food and social security, not just jobs, but food and social security. So even here at home, we are seeing, so there's no doubt, Dr. Dikhamela, and even in our Gauteng economy, and I just want to go to specifics of what the impact has been on our economy there. There's no doubt that COVID-19 is more than a pandemic, it's more than a health emergency. So it's a socio-economic disaster, global disaster of the proportion of the 1929 Great Depression. So in our case in particular, so we are estimating in our modeling in Gauteng, we did an assessment. There are two scenarios. The best case scenario, we will have about 800. We have revised the numbers from 600,000 people losing jobs to 890,000 people losing jobs. In this, we're saying in the best case scenario, in the Gauteng economy alone, there will be up to 900,000 jobs lost. In the best case scenario. In the worst case scenario, it's up to 2 million jobs will be lost in the Gauteng economy. You know the numbers at a national level is 7 million jobs. So Honorable Mpisi, in terms of job losses, it will be severe. In that sense, Honorable Dikhamela, so it will be quite severe. So it does require a comprehensive response, as Honorable Msimanga was saying. It requires an economic stimulus of a special type, taking into account the national economic interventions. So what is it that we have done? Because we can't fold our arms and sit back. And indeed, in our particular set of circumstances, one of the key things is that social distancing, whereas the national lockdown has been very helpful, but there are other things that are difficult to implement in our unique conditions. Social distancing has been difficult, particularly in areas, overcrowded areas, densely populated townships, and informal settlements. And this is the ugly face of our own country: inequalities and special injustice really has been accentuated and be brought into the open by COVID-19. Secondly, food insecurity. There are too many people in our province who are food insecure, and COVID-19 has just exposed that many, even those who work, if they don't work just for 1 month, they literally revert back to the street. They have nothing. So the lockdown has revealed that if a lot more people, even those who work, are not earning enough to guarantee their own livelihoods. Worse with those who don't work. More than 2 million people who are unemployed in our province. So food insecurity has accentuated urban poverty in our province, revealed and exposed acutely by the lockdown. And the numbers of food insecure people are just astronomical. And Honorable Ntsege was talking about the food issues now. We know that we have assisted over 600,000 people in Gauteng since the national lockdown food parcels. Over 600,000 people with food parcels. Yes, there have been big challenges. The demand has been huge. We think we have done our best. We want to continue to improve. But the big issues is that inadequate infrastructure is a big problem for social distancing. Vulnerability is high in the informal settlements. Women have also been feeling the brunt of this situation with increases in gender-based violence. So the gender dimension that Honorable Takile is raising, race and class, the people in the informal settlements, I'm saying in the townships and informal settlements, social distancing only works in the suburbs, in middle-class families where people are living a bit more comfortably, fewer in numbers. Social distancing is difficult, but we have been pushing even with that to ensure that people can wear masks, but that in public spaces, the social distancing, and we intervened in a number of areas. We are decongesting some of the informal settlements. We have been putting water where there was no inadequate water. But the reality is that the economic impact would be far more than we have ever thought or estimated at the moment. And it is for that reason, Honorable Dikhamela, that we can't have a lockdown at this level for long. So it's for that reason that we are working with various sectors. Tomorrow, we are meeting with various sectors of the economy. We are preparing for level 3. We want to move to level 3 to reopen the economy, but as Honorable Mpisi says, in a responsible way, in a more cautious way, to go to level 3, insist that we balance the health imperatives with the economic imperatives. We can't stay at level 4 for too long because too many people don't have the means to support life. We don't have enough resources to provide assistance to those people who would otherwise work, those who have works, but we also know that there are those who are going to lose jobs. And national government's interventions on the COVID-19 grant will assist those who are unemployed. But beyond this 6 months, we must be thinking about what to do. So, and again, I want to conclude by saying that the provincial government on the economy has made 2 interventions. The first one is that we are working with all the sectors of the economy to help them to access the stimulus package that has been put in place by national government, the 200 billion rand stimulus package. In some areas, it's even more, depending on what incentives are there. That's the national level. I have briefed the leaders of the political parties in our legislature that we will also, and I want to take members of this House into confidence, we are also working with the SME fund set up by the CEO initiative to focus on what's called a partnership fund of 1 billion rand. The provincial government is setting aside a small amount towards that, and then the private sector is bringing a bigger amount, so that a 1 billion rand fund that will be targeting small enterprises, but particularly township-based businesses, the informal sector, those in our CBDs. So the SMME, what is called the SMME Partnership Fund, which we are setting up together with the SME Fund of the CEO initiative, is our stimulus package to help township businesses, to help small enterprises, to help the businesses owned by youth and women in various sectors in our province, to have access to capital and cash flow for them to come back during level 3 to run their operations, because we know many businesses have suffered. They may not have the cash to even employ the people they were employing. So that fund will go a long way in helping us to get to level 3 reopen. I must also conclude by saying we are doing another important thing to prepare for level 3, reopening of the economy. We don't agree with those who think that we must just open the economy anyhow. That the lockdown has not worked. It's irresponsible. We see it in other parts of the world. We see COVID-19 resurging. We see new waves in Asia coming back, more new infections. We see it in parts of Europe. We also see it in those areas where people are irresponsible. They just want us to reopen the economy anyhow. They are playing with people's lives. We can't do that. We are taking it in phases. And I'm glad that the leaders of the political parties in our province have been supportive of that strategy. So, but we are also targeting two geographic and sector targets. On the one hand, going to level 3, we are focusing more interventions in the townships. Back to Honorable Dakile's question, because we are seeing that the suburbs have more recoveries as we speak now and fewer active cases. And the townships are the ones that have new confirmed cases now. There are still few. The rate of infection is still low. The numbers are still low. But we know that COVID-19 spreads through cluster infection. So if you allow someone who's tested positive to remain in the area where they are, and their contacts are not traced effectively and taken out of that area, you are running a risk of more infections. So in the last week, we have particularly been focusing on these geographic spaces, the townships and the informal settlements, because that's where some of the new cases are coming. We are directing a lot of our health resources there to intervene, to trace and track, and in those cases where people are already getting severe symptoms, to treat them, to get them treated in our facilities. So basically test, treat, or test, trace, treat, isolate, and we are already isolating people who are infected in the townships. We are putting them in our quarantine facilities, like we did with people who were infected in the suburbs, although many of them said they could isolate themselves, they could quarantine themselves, and we didn't have a problem with that. So there's no doubt that in the next 2 months, a lot of our testing interventions, whereas before those testing interventions were targeting the suburban hotspots because COVID-19 was not in the townships. Now our interventions on testing, tracing, and targeting to quarantine and isolate are focusing on the townships because that's where we are getting a lot of new cases. And the last area of targeting is the economy, various sectors of the economy. Last week we started with targeting the retail sector. The retail sector in the Western Cape is the one that has led to the major cluster outbreaks. These shopping malls, these supermarkets, we in our province have targeted them. We are making sure there must be compliance there. No one should come to the shops there and allowed to buy without a mask. There must be social distancing. There must be sanitation. We're also targeting the public transport system. We are doing lots of disinfection at the taxi ranks, in our public transport corridors, in our public transport modes, social distancing to enforce the numbers there. And tomorrow when I meet with the various business leaders, we are assessing with them which sectors have put in place all the WHO compliance measures, because WHO says for you to ease the lockdown, to open more in the economy, you need to meet certain requirements. Number one, people must have a higher level of awareness and education. And I must tell you, in some of our townships, we still have problems. People are walking up and down in large numbers. They are not wearing masks, but we are tackling that now. We will work with councillors throughout Gauteng to target those. But the shopping malls, we have some shopping malls are complying very well and others are not. We will target them. We want to work with you as members We want public representatives to work with us to target areas where compliance is low, to raise awareness, but to also work with the law enforcement agencies to ensure that those who don't comply, especially establishments, workplaces, they must be held accountable. And this I will be discussing with business tomorrow. We are going to level 4 in May, Honorable Speaker. We are going to not in May, in June, at the beginning of June, we are going to level 3 as Gauteng, but Gauteng cannot go to level 3 in a disjointed way. We can't have one municipality, a metro in level 4 and another one in level 3 or another one in level 2. Even the districts are highly integrated. We are going to level 3 together. And therefore, I want to thank you again for the opportunity through question time to give us time to report. But we need you more than we have ever needed you before. We need you as our honorable members to be with us out there to be fighting COVID. And I am glad that none of our members, we have not lost any of our members so far to COVID-19. Let's continue to pray that it will remain like this. But we are public representatives. We must not, it's not just government that must go out there and work on the ground. We want to work with you so that come the peak, Gauteng must still be in a much better position. We should save more lives. And beyond COVID-19, we want our economy to work for all. We don't want to come back to the same economy that excludes millions of our people. We want an economy that is more inclusive. Thank you very much, Madam Speaker.
Thank you, Honorable Premier. I think the call is being noted and members will be able to take that call, they hit that call to ensure that we assist on the ground, because we're in this together. It's not only the issue of the executive. Thank you very much. In terms of Rule 134, we're now going to deal with questions to the executive, starting with Honorable Fuchs to MEC for Health.
Madam Speaker. Madam Speaker.
Honorable Simanga.
It's Moriarty.
No, I see the head of Honorable Simanga. Okay, let's hear Honorable Moriarty.
Yes, I have not heard an opportunity given to Honorable Dikhamela to respond to the Premier, and then the opportunities in terms of Rules 138 subsection 9.
Honorable Dikhamela.
Thank you, Honorable Speaker. Welcome back. Yeah, I think it's a great input that we have received from the Premier. It is very much appreciated, and putting the people of Gauteng first is the major thing that is appreciated also, and also considering the WHO, World Health Organization guidelines, principles as we progress forward. Thank you very much, Honorable Speaker.
Madam Speaker, you're on mute.
Speaker, unmute your mic.
Maybe Chair of Chairs must come back.
Honorable Dikhamela, please don't interfere. You were supposed to ask a question to the Premier.
No, I'm done.
In terms of Rule 134, can I ask Honorable Fuchs to ask your question to the MEC for Health?
Madam Speaker, are there no hands for 138 subsection 9?
Honorable Moriarty, we are done with 138. We are on 134 now. Can we be ordered, members? Honorable Fuchs.
Chair, thank you very much.
Can members please switch off their mics, Speaker?
My mic is off, colleagues. I don't know what's happening.
Am I audible, Speaker?
Yes.
Thank you. The Department of Infrastructure Development has publicized the work it is doing in terms of the COVID-19 pandemic and indicates that it is refurbishing existing public health facilities as well as external sites. In light of this, would the MEC please indicate how many additional beds over and above what existed before have been created within both government-run facilities and external facilities for A, standard COVID hospitalization, B, high care, C, ICU care, and D, quarantining and isolation? Number two, what is the total cost in rands and cents of these activities, these building and refurbishment activities, and from which budget line items are these costs allocated? Number three, in the event that existing health facilities are overrun as the pandemic ramps up, does the department have plans in place to build additional facilities? Number four, if so, please provide an overview of these plans in order to meet the demand as and when the additional facilities are required. And number five, does the COVID crisis offer any potential to improve the relationship and work more closely with private sector infrastructure companies? And if so, is the MEC actively seeking opportunities to enter into public-private partnerships with such companies? Thank you, Speaker.
Can I come in?
Honorable Masuku? Yes.
Okay. Good morning, honorable members. Thank you, honorable folks, for the question. I will start by indicating that we have taken a view. I think the Premier had actually indicated that we have taken a view as the executive that we are taking the pandemic also as a good opportunity for us to fast track some of the things that we have been discussing all along, even in the committees, and making sure that the plans that we've put into place are actually going to be fast tracked and some of them to be brought forward. So in respective of your first question on how many additional beds that we have created, in terms of the facilities, so what we have done, or how the health system or the health department has structured itself, it has structured itself according to clusters as being led by central hospitals. So these are clusters of clinics and hospitals that are overseen and managed by the academic heads of the departments, like disciplines that we have in the whole thing. So we have a George Mukari cluster, we've got a Chris Hani Baragwanath cluster, we've got a Charlotte Matsege cluster, and we've got a Steve Biko cluster. So in terms of that, it means that we are adding beds in terms of clusters because they are going to be working together in that respect. So with George Mukari cluster, which includes OD Hospital, also includes Jubilee Hospital, we have already created 239 ICU beds, also meaning that we are looking at what is there in George Mukari. And the beds that are available in the cluster currently are 239. So the 239 beds are being created as we speak now in terms of decanting non-COVID-19 patients and also refurbishing some of the wards, which is almost work that is complete at George Mukari. We also at Chris Hani Baragwanath cluster, we've got 150 ICU beds, which are available currently. And as we speak now, DID is finishing up 321 ICU beds in that cluster. This also includes work that we are doing in Lenasia South, which is a CHC, but because it's part of the cluster of Chris Hani Baragwanath, some of the beds will be there, and that we are creating space in that regard. In the Charlotte Maxeke cluster, we've got 104 ICU beds and 563 isolation beds, which are beds that have been created, and we are waiting to decant some of the patients currently to open up 10 ICU beds more, and also to create 26 additional beds for the Charlotte Maxeke cluster. The Charlotte Maxeke cluster includes Bethakoa. It also includes Eden Vale. The Steve Biko cluster, we have created 111 ICU beds, which also include the Tshwane District Hospital, which has been designated as a COVID hospital. And we also creating currently 40 additional beds in Tshwane District to add on to what we have. So basically, that's what we are currently having. It's 1,130 beds available as we speak, and we are creating 610 additional beds as a work that has been done. And we are following it quite closely with the DID MEC. I have to also indicate to the House that the working relations and the working patterns of both DID and health has actually improved tremendously, as we have indicated in the past. We also have, in terms of government facilities that are offered to us, we are revamping Anglo Gold Ashanti in Carltonville, which has been offered to us. The initial plan was to create 200 ICU high care beds in that hospital, but because of space required for ICU, the number of beds that will be there will be 180 beds that are there. So we are working around that figure in the west of Gauteng with the Anglo Gold Ashanti. And in terms of quarantine and isolation, all the isolation areas that we have outside our health facilities, because Discoverers has got over 60 beds for isolation and quarantining. Lenesia South has got almost 100 or so beds for isolation and quarantining. But these ones are the ones that we are using, which are not medical or health facilities. It's ESCOM Academy in Midrand, Transnet, SLN Park in Captain Park, Telkom School of Learning, also in around Olifantsfontein, and Rodeplat Dam Resort in Tshwane. And we are also have created beds in Nasrec, which are almost 500 beds. And all in all, in terms of our quarantine and isolation, we've got 1,808. These are beds that we as the province have acquired and that we are running as we speak. And our occupancy rate is always have been less than 30% occupancy rate in all of these facilities. What is the total cost of these activities? The cost will be estimation in terms of the work that is done, because we'll only be able to, in a complete sense, be able to cost it accurately after they've been done and have been. But the estimations of the work that we've been doing is the one that I'm going to give you. And the source is also the source of the equitable share allocation, which has been reprioritized. And remember that we also had budgeted some of the infrastructure work. So it's part of the thing that, and then when there are other sites that are actually sponsored and which are donor funded. The next other funds that we have, it's the money that we are going to recover from the cost in terms of a disaster management fund as it's being dispersed. So with George Mokari, the estimated cost is around 70 million, George Mokari cluster. Krisa needs around 43 million. Charlotte Maxeke cluster, it's all sponsored by companies. Steve Biko cluster is almost like 999 million, which is also from our budget allocation. Then we are also building extra beds capacity with alternative building technology, which building is going to start by the first week of June. The 300 beds in Kopanong, 300 beds in Jubilee, 300 beds in George Mukari, and 300 beds. So the amount all in all will be around, for all these beds, it's standard figures, which is 538 million for each of these. So it's almost times 3 of the whole thing. For Anglo Gold Ashanti is 340 million. Then the other quarantine sites, like I've said, Eskom, Transnet, Telkom, Rodeblatt are free. They are sponsored, and then the Nasrec is 83, but some of the cost will also be taken from actual sponsorship. We have to indicate that we are intending to start the second phase in the week of the 20th or 21st of Johannesburg in Nasrec, of extra 500 beds in that area. The third question that you asked was in the event overrun, does we have a plan? Yes, the plan is there, and the issue of putting up extra capacity in the 4 hospitals, as mentioned, is part of it. But the other plan is also to add, on the third phase of Nasrec, is to add extra 500 hospital beds, which will be high care and ICU beds in that regard. And we are looking at the situation quite closely. We're also working with private sector over and above the beds that they've already given us, availed to us for COVID use. It's one of those that we are working on them. So we are pretty much at a comfortable space where we can say we do have enough space for this. The fourth question is these plans in order to meet the demand. The department, we have, like I've said when I answered the other question, that already the RFPs and RFQs have been received from different companies on the turnkey solution on the building of the extra capacity in the 4 hospitals. And we are hoping to start the earliest in June, so that by mid-July or at July, we can be able to have this ready to be used. So already this has been done. We have been, you'll remember, since we started the term of office, I've been saying to the committee itself that we are working towards getting alternative funding for a lot of our projects, particularly the standard projects. I think the last time we had our meeting in Tembisa, we did indicate that the Minister of Health and the Minister of Finance had agreed in principle on the arrangement on how the triple Ps will be actually arranged. So we are just waiting for now to complete the whole process from our side. It's just we're interrupted by COVID on how we can then start the process of getting RFQs and RFPs from different individuals who've got the funding. We've met a couple of people who have come forward to say that they can be able to help us, but we're just hamstrung by the arrangement and the engagement with the Minister and the Minister of Health and the Minister of Finance. But this is underway, and we are quite confident that these triple Ps will make us able to deliver these hospitals in a short space of time and with quality work that will be done. And this is what we have been doing. Thank you.
Any supplementary question, Honorable Fuchs?
Speaker, thank you very much. MEC, thank you for your response. Just 2 comments. The hard lockdown was an opportunity for us.
2 comments, 1. Honorable Fuchs, 1 comment in terms of the rules.
Thank you, Speaker. The hard lockdown was an opportunity for us to build resources while flattening the curve. If you look at these additional resources you referred to, MEC, we're talking about a lot of money. And although I'm a firm believer that hope is not a strategy, I hope that we've maximized the opportunity to create these additional facilities so that we can cope with any deluge of infections that is likely to happen. Thank you, Speaker.
Thank you, Honorable Masuku.
Yeah, I agree with you that hope is not a strategy, and we are working hard in making sure that those the available beds are already ready. The issue is how we are going to start. In the next time when we meet or when you see us, we will be opening this extra capacity of the beds that we are building in the 4 hospitals, because we are also thinking beyond the pandemic. It's not about the pandemic itself. It's how the capacity of the health sector and the health system would be beyond actually COVID. But your point is actually taken. Thank you.
Thank you. Honorable Bloom to MEC for Health.
Thank you, Madam Speaker. To the MEC for Health, regarding the interrupted collection of tuberculosis and antiretroviral medicines because of the lockdown measures, will the MEC please indicate, 1, what approximate number of patients have failed to collect their TB medicines since the 27 March lockdown? 2, what approximate number of patients have failed to collect their ARVs since the 27 March lockdown? 3, what measures are being taken to ensure that they receive these medications? 4, what is the approximate percentage reduction in medicine collections for TB and HIV/AIDS patients since the 27 March lockdown? And 5, what is the anticipated impact of treatment gaps for TB and HIV/AIDS because of the lockdown measures? Thank you.
MEC, you can respond.
Okay, thank you, chairs of chairs, and thank you so much for the question, Honorable Bloom. I just want to paint a small background on the issue relating to what you are raising on TB and ARV medicine, because the issue of follow-up of patients with TB and HIV has been it's a national issue that has been preoccupying us in many instances to make sure that our patients with TB and HIV are able to adhere to the treatment and able to adhere actually and comply with the treatment. And one of the roles that is played by our ward-based outreach teams, which are our healthcare workers, community healthcare workers, is also to try and actually do that. The national statistics, as we are looking at this, is that 28 to 30% of people who are on ARV treatment usually are lost to follow up. But really in Gauteng, people do move out and migrate to their original provinces where they come from when they are sick. So we do have a high number of lost to treatment, which is around 28 to 30% on ARVs. And for TB, it's around 12 to 15%. And we had looked at different factors commissioned by different institutions to look at what are the factors that contribute to this. I think the whole issue is just the mobility, high mobility of our population and citizens, and also the issue of giving unreliable and incorrect addresses becomes a big issue because of fear of stigma around TB and HIV, and it makes it difficult for tracing and tracking. And also with just the contact details being given incorrectly or wrongfully to mislead the team. But basically, that's the major issue that we are facing in terms of them. So it's important for us to point out this background so that we understand that it's not an issue that normally would just have to be a new phenomenon because of the lockdown. It's something that we've been dealing with, and we've put systems into place, research to see on the factors, and we are continuously mitigating on how we can be able to actually sort that out. And the community healthcare workers teams have been quite active in this regard, and we had some reasonable success in this regard. To come to your questions, to be exact on the approximate number, we failed to collect their TB medicines since the lockdown is 1,090. The second question, you said about ARVs, where approximate patient that failed to collect their TB medicines is 10,000. The ARVs is around 10,950 that are there. And the third question you asked, what measures, like I've said on the background, that we've activated our ward-based outreach teams who have been on the ground looking for those individuals and making sure that they get their medicines. And the fourth question, and the work that they're doing, it's a daily work that they're doing every day to try and track and trace those individuals who we are following up on HIV and TB. The fourth question is on the percentage reduction. Since the lockdown, the average reduction on medicine collection is from 1.4 for TB and 19.6% for HIV ARV treatment. What is the anticipated impact? Of course, the impact is the issue of people of drug that creates interruption. The one important thing is drug resistance that usually does occur. And the second one is that the health of those individuals might deteriorate going forward. And it creates a bigger problem for us to have the challenge of dealing with all this resistance and all these other syndromes that come when somebody had interrupted their treatment. And I think we all know that we all want people to have viral loads that are quite low and undetected. So this is just one of the causes that would have made it difficult for us. Thank you, Chairs of Chair.
Thank you very much, Honorable MEC. Member Bloom, any supplementary question or a short remark?
Yeah, thank you, Madam Acting Speaker. Yes, I think we all agreed that while we've got the COVID-19 health crisis, we don't have another health crisis. And of course, TB is a massive killer still in our country, and so is HIV/AIDS. So I think we must do everything that we can to ensure that people collect their medicines. But I'd just like to ask the Honourable MEC, what arrangements we made so to decentralise medicines? Because I think that's particularly important. That I know efforts were made beforehand, but you don't want people congregating at hospitals and clinics, particularly vulnerable people, TB patients and HIV/AIDS patients. Surely we should be expanding efforts to make it more convenient for people to pick up, especially with the lockdown restrictions, transport problems. I think this is the problems that we faced at this particular period. Thank you.
Honorable MEC.
Thank you so much. Yes, indeed, that's what we are putting in place. And remember, this is the work that we have been doing even before the COVID, in also increasing the number of patients or individuals who are going to get their medicine through the chronic dispensing central dispensing system, which now we are closer to we're coming over 1 million with people who are actually registered with it, who are getting their medicines there. It's not without problems. The problems, we are also actually sorting them out. The other system is the one on using our warboards teams, our community healthcare workers who will be going out there to give particularly the elderly patients their medicine. So these are plans that we've been trying to improve on, and because I feel that it's going to be a new normal, we have to work around making sure that the decongesting process is continuing and the system actually continues actually to be effective and increase its capacity.
Can I ask members to... Members, can you put your mic on mute, please, in order for the Honorable MEC to respond to questions, please? MEC, you can continue.
Chairs, before the MEC continues,
No.
Can we ask the staff from the GPG in particular? They are connected in the system, and it's logging us, Chair. No. We are losing the debate, Chair. That's why I'm raising the point of order. Because we keep on being booted out by the system.
Okay, I wanted to make this announcement. Members, can I request all members to be disciplined? You are not entitled to invite participants to this debate. Please don't invite any guest to this debate. The only people who can participate here are actually selected staff members as well as members. Members of the public and other interested parties can join us through YouTube or Facebook. As soon as you start inviting guests to our debate, we'll immediately take you out of the debate because you are disturbing other members and also disturbing the decorum of the House. Please stay away from inviting your members from political parties or members of the public to our debate. Please, members. Honorable MEC, you can continue. And thank you very much, Honorable PC, for raising this issue.
Madam Chair of Chairs?
Yes.
Yes, thank you very much. Yeah, I want to support Honorable MPC. I think his point is more that if we look on the list of participants on the teams, it's 104. We are 73 members. And what I hear Honorable MPC saying is, could the staff members who are not essential, they're not part of the tables proceedings, please get themselves off the teams and go on to the YouTube, which is what you've indicated is also available. Thank you, Madam Chair of Chairs.
No, thank you very much, but I've already thanked Honorable Mbisi for raising this issue. It's not only staff that is actually on, it's people who have been invited by members as guests to this debate. That's why I'm requesting members, please make sure that you inform your people or your constituency that they can join us through YouTube or through Facebook. We are actually, our system is becoming overloaded, and we're also avoiding to get unnecessary or embarrassing images on our system. Please stay away from inviting people. As soon as you start inviting people, we'll actually remove you. Thank you very much, members, for raising this. Can we then go back to the Honorable MEC? MEC, please continue with answering the questions.
Yeah, no, thank you, Chairs of Chairs. I was almost done, but maybe just to make this point, importantly, is that we have already started in terms of our plans to create what we'll call non-COVID hospitals, where we are going to decentralize some of the work and some of the procedures to hospitals which wouldn't be treating COVID patients, so that we start to activate the system and to deal with the procedures that are elective and also semi-urgent. So this is the work that we would be announcing in due time, so that as we move to different levels of lockdown, we also start activating and properly handling some of the services that were interrupted by the pandemic, especially the lockdown. Thank you.
Thank you very much, Honorable MEC. In terms of Rule 134 in bracket 7, I now open up for additional supplementary questions or additional remarks from the members. Any member want to speak? Members, I won't be able to see your hands, so please use your voice to indicate your interest to speak. Thank you very much. There is no comment from the members. I'll then move to the next member or next question. Member Bloom, please ask a question to the Honorable MEC for Health. Your second question, Member Bloom.
Thank you, Madam. No, I don't have I've made my follow-up. I think that the MEC has replied, so I think I should be moving on to my next question.
Yes, that's exactly what I'm saying. Your next question, Member Bloom.
Thank you, Madam Acting Speaker. Regarding cancelled or deferred surgery at the Schadenkleke.
It muted you out because you called the name of Charlotte Maxeke wrong. So it's Charlotte Maxeke. Member Bloom, please ask your question.
3, whether alternative arrangements at other hospitals can be made for the affected patients. If not, why not? And 5, what is the impact of the cancelled surgery on patients? Thank you.
Thank you very much, Member Bloom. Can we then ask the Honorable MEC to respond?
Yeah, I think I will start with the last question, Member Bloom, and thank you for the question. It's one of those important questions that we need to respond to. That, of course, when we cancel any surgery at any given time, we do have a problem of emotional stress that normally comes with waiting for an operation, and also the anticipation and anxiety that comes with it. Also, the issue of a future absenteeism that comes with it in terms of anxiety. But coming to your question is that the first question is that since the lockdown, in terms of departments in orthopedics, essentially we had deferred almost 183 actually surgery, and that is different type of surgery: arthroplasty, spine, pediatric, foot and ankle, and other sports trauma actually surgery. In terms of ophthalmology, which basically it's mainly cataracts in a main sense, it's 499. In terms of gastroendoscopy, it's 420. In terms of breast, is around 30. Thyroid is around 9. So we have all listed all this according to different type of procedures and operations since the 27th. So we have in total is 1,413 procedures that has been deferred, because I don't think we have to use the term cancelled. They're only deferred because they are non-agent at the moment. The second question is that the cancer operations have been continuing in most departments, if not all, and we have been doing a number of oncology cases, because we know that oncology cases have got a bigger problem if we cancel it, and we cannot do them as non-agent. They are always emergency operations, those ones, because of the spread and the possibilities of complications coming from the cancer itself. And also, similarly, we have also got a similar attitude towards obstetrics cases, your cesarean sections and all others, including the pediatric operations. Those are the ones that are continuing as we speak currently, even at this level of the lockdown. The third question, in terms of arrangements, yes, indeed, there have been alternative arrangements, particularly for minor cases. And this is also one of the model or the backdrop of why we want to create non-COVID hospitals, so that these type of procedures, they start to continue and they become active. So alternative arrangements at Helen Joseph, they've done some of the less complex cases, and other regional hospitals like Bertha Kowa and Southern Hospital have been doing some of the operations that are minor and which are less complex in that regard. And this is just one of those that, in terms of complexities, we have able to make sure that other hospitals are able to do this type of operations. Or your fourth question is not applicable because we have arrangements for some of the hospital operations to be done. Your last question is the one that I started with in terms of the impact of the surgery. It's mostly emotional and anxiety, stress that comes with it. The most of the operations that are linked to oncology have been done, and we are trying by all means to make sure that we are able to give that service going forward. Thank you.
Thank you very much, Honorable MEC. Can I then ask Honorable Member Bloom to please make a follow-up or a short remark?
Thank you, Madam Acting Speaker. Yes, I mean it's always distressing to have deferred or cancelled operations. The existing list is very long, and unfortunately, it appears that we're going to be in this situation, the pandemic situation, for quite some time. So I'm pleased that the department's looking at using other hospitals. I think that it's essential that we get other surgery done. The problem with a lot of elective surgery is it could, if you leave it too long, it could become emergency surgery or it deteriorates. And of course, there's all the emotional stress that people face because of deferred surgery. So yes, I think we need to look to the longer term as well, and alternate hospitals that can take the strain off one of our major hospitals that's now doing mostly COVID-19 cases. Thank you.
Thank you very much, Member Bloom. Can I then ask the Minister to make a remark or to answer this question?
No, thank you. I think that's what we'll be planning, and I think the whole thing of clean hospitals, what we are going in inverted commas, clean hospitals, the non-COVID hospitals, that's where we're going to be trying to deal with all the issues that relates to the backlog and also the deferred operations. But thank you for the remark, Honorable Bloom.
Thank you very much, sir. Can I then, in terms of Rule 134(7), I now open for additional supplementary questions or additional remarks from the members? Thank you very much, members. May I then request Member Nteke to read the fourth question to the MEC for Education. Thank you very much, MEC for Health, for your response, sir.
Thank you, Acting Speaker. Regarding learners that are part of the school feeding program, would the MEC please indicate how many learners are on this program in the province? With the lockdown, how are these learners being assisted with nutrition? Did the Department of Education give the database to social development? How much money was transferred from education to social development for this initiative? And how much of this money has been used? Thank you, Acting Speaker.
Thank you very much, Member Nteke. Can I then request Honorable MEC Lesufi to please respond to your questions? Honorable Lesufi?
Thank you so much. Yes, thank you so much, Chair of Chairs. Thank you so much, Member Nteke, for the question. Good morning, members. Regarding learners that are part of our school feeding program, we are feeding almost 1.5 million learners through our school nutrition program, and majority of this funding comes from the National Department. During this lockdown period, the National Department wrote a letter to all departments and indicated that because the lockdown coincided with the Easter holidays, that there will be no need for us to feed the learners during this period. However, working together with the Department of Social Development, And utilizing the criteria used by the Department of Social Development, majority of our learners were taken care of through that program. It must be noted that we had lots of discussion with the Department of Social Development, but unfortunately, due to logistical, legislative, and regulatory challenges, it was extremely difficult for us to transfer money either to the Department of Social Development or request the Department of Social Development to execute this mandate on our behalf. It must be stated that the Department of Social Development, through their school feeding, through their feeding program, they also target child-headed families or children that are staying alone or families that has a high number of children to feed. And we assume that majority of our children were not exposed to poverty, and that majority of them were part of this particular program. Thank you so much, Madam Speaker.
Thank you very much, MEC. Member Nteke, any supplementary question or short remark?
Thank you very much, MEC. I think my biggest concern is that we make sure that during the COVID, because this has been longer than the school holidays, that children don't fall through the cracks and end up in starvation. And that is an appeal that I want to put, and I'm glad you're acting on both departments. So you should ensure that there's no child who goes hungry, as you usually say in the house. Thank you very much.
Okay. Comment, Member Nteke, can I then invite members in terms of Rule 134 and Bracket 7 to make any additional supplementary question or additional remarks? Thank you very much, members. We'll now move to the next question. Questions by Member Nteke directed to the acting MEC for Social Development, MEC Lesufi. Member Nteke, can you read your questions, please?
Sorry, Chair, can I respond to the last statement made by Member Nteke?
Oh, okay, you want to respond? Sure, you can respond. Sorry, MEC Lesufi, I thought you're not going to respond. Please, can you respond to the remark made by Member Nteke? My apologies.
Thank you so much. We welcome the advice and the guidance. We'll indeed implement that guidance. But we will see later on that the National Minister will make an announcement on the reopening of schools. And part of the solution that we have incorporated in the reopening of schools, that even those children whose grades are not going to be reopened, will encourage those children to utilize our school feeding programs, and they will be welcome to come to our schools to receive school nutrition. So we'll indeed ensure that children don't go to bed with an empty stomach. I felt I needed to clarify that part, Chair. Thank you so much.
Thank you very much, sir, for your response. Again, can I invite Member Nteke to please ask the questions to acting MEC for Social Development, Honorable Lesufi. Member, can you read your questions, please?
Thank you, Chair of Chairs. With regards to the food distribution that took place at Luvenhout and Moy Plus, could the MEC please indicate who organized each of these distributions? How many food parcels were available for each area? What criteria was used to determine the beneficiaries? How were the community informed that they would receive these parcels? And how many people arrived in each area to collect food? Thank you very much, Acting Chair of Chairs.
Thank you very much, Honorable Nteke. Can I then request Honorable MEC to please respond to the questions?
Thank you so much, Chair of Chairs. Thank you so much, Member Nteke, for the questions. The irony of your question, Member Nteke, is that during your member statement this morning, you questioned why the department is requesting NGOs to work with us in order to distribute food parcels. And now you come and ask us information about the same NGOs that are distributing food parcels, but you are discouraging them from working with us. It's contradictory and very difficult to understand. And our approach is very simple, so that these NGOs must coordinate their work through government so that we can come and account to you and respond to those questions. But if you don't want this organization to work with us or to coordinate the activities through the department, it makes our task very difficult because there's possible duplication. They might feed the people that don't need that food because government has already provided or another NGO has already provided. And it might also be people that either are not qualifying to receive some of this support that are coming from communities, partners. Our argument is very clear. We don't want to steal the thunder of NGOs. We don't want to take over the work of the NGOs. We don't want to block the NGOs. Or do you want to centralize the distribution through government machinery? We are only requesting coordination, that let's coordinate this work properly. And in coordinating this work properly, we must ensure that the regulations are adhered to and are respected. What do we mean by adhering to regulations? There are matters of social distancing, there are matters of sanitization, and there are also matters that are related to whether people can prepare cooked food or not cooked food. I mean, we can't say institutions that are preparing cooked food can't distribute cooked food and then allow NGOs to do so. It might not be explicit in the regulations that NGOs are not allowed, but it is explicit that cooked food is not allowed and cooked food was not allowed during the lockdown. And that's the approach that we're dealing with. We are not saying NGOs must not come and provide the relevant resources. We need the extra hand of NGOs. And we're not going to stop NGOs that want to provide support to vulnerable groups, especially those that are weak and vulnerable. Our argument and our approach is that if we coordinate this thing together, of ensuring that the army is notified, the police are on standby, the local councillor is notified, and the community is also notified that we are going to distribute food in this particular manner and in this particular mechanism. But we don't want to steal anyone's thunder. And the argument and the insinuation that is being sent either by the political party that we represent or another political party that has raised questions and is threatening to take us to court on this matter, is that we don't want to steal anyone's thunder and we're not prepared to fight over who must distribute food to whom. We really want to provide guidance, systems, and ensure that the right people get the relevant food. As I said, it's ironic that you are asking me about NGOs, but you are at the same time saying NGOs must not work through us or NGOs must not cooperate in distributing food through government departments. But because this NGO that we have asked information about is working with us, we can safely give you the information we have requested. And we'll urge other NGOs to do the same. Work with us so that we can account on the society and we can also notify institutions like Parliament of the work that these NGOs are doing. So the distribution in Olivenhout was organized by Mahlasedi, which is part of the 3C Church based in Centurion, while the distribution in Moy Plus was organized by Ward 61, community safety-based organizations there in Erasmia. And in Olivenhout, Mahlasedi Foundation was targeting 30,000 households. Actually, they came to us, they said they want to give everyone in Oliven a food parcel. And we asked them, what do you mean giving everyone? They said exactly that. We want to give everyone a food parcel. Whether people are working or not working, whether people are hungry or not hungry, we have the capacity to give them food parcels. And when we check their capacity, indeed, they've managed to deliver more than 30,000 food parcels. In Moy Plus, they wanted to target 5,000 people, but 8,000 people arrived and they gave all the 8,000 people the food parcel that was needed. They are working through a group of volunteers who conducted door-to-door registration. Actually, the Mahlasedi Foundation in Oliven, they are more organized, and I think in some instances, other NGOs, including government, we should copy their model. What they are doing before they distribute food, they go house to house, door to door, register and give each family a sticker that is a barcode. So by the time you come, they just scan the barcode and they know if you are a family that has more than 5 people, they will give you 2 packets of the food parcels. And their food parcel is 3 times the size of the food parcels that government provides. So they're a very organized a foundation that we should learn. And they practice social distancing, and they also bring sanitizers in all their events. And they've managed to distribute in each and every area in all events. And they're still continuing to distribute food in that particular area. In terms of Moi Plus, the organization, as I indicated, targeted 5,000 people on a single day. However, 8,000 people arrived, and all the 8,000 people were provided with food parcel. And the organization plans to return to the community of Moi Plus later this week to do a second round of distribution for the beginning of June. Thank you so much, Chair of Chair. Truly appreciate the opportunity.
Thank you very much, Honorable MEC, for your response. Can I then check with Member Ntseke if she has a supplementary question or a short remark?
I have a supplementary remark, please, Chair of Chairs.
Okay, please continue.
I think the first port of call is there's no contradiction. For me, when we talk about fighting against cooked food, is to say we are fighting the blocking of cooked food by NGOs. The second thing is, clearly when you listen to the response of MEC, they themselves are acknowledging that had they not collaborated with NGOs, they would never have fed the 110,000 people that were fought by Mahlasedi and the CPF in Moi Plus and Olivenhout-Bosch. So all we are asking is, it is important that a government collaborate, not block NGOs, in order to make sure that hunger is prevented in this province. And in your own responses, MEC, you yourself can see that NGOs need to be empowered. The permits, for example, are a problem where people have to apply every time they distribute. But once you can collaborate better and enable NGOs, we can reduce the hunger far more significantly, because they are sort of the tentacles that actually help this government to ensure that nobody goes hungry in this province. I thank you, Chair of Chairs.
Chair of Chairs, can I come in,
PC? Yeah, it's okay. Member Mbisi, I'll call you. Can I then request that the MEC respond? Let me check if he's supposed to respond immediately. No. Can I ask members in terms of Rule 134 in bracket 7 to now to make additional supplementary questions or additional remarks?
That's what I want to do, Chair. Thank you very much. No, Chair.
Yes,
thank you very much, Chair. I think the MEC is correct in responding the way it did. The issue here is not about the non-collaboration with the NGOs. The issue is the NGOs do not have capacity. And I want the MEC to expand in his response as to what kind of measures are they putting in place as a department to make sure that whilst they work with the NGOs, things are run smooth compared to what we saw the first day in Olivenhout-Bosch. Thank you very much, Chairperson.
Okay, thank you very much, Member. Can I check if there's any other member, please?
Chair, I want to also make a...
It's Ghana.
It's Tumisani.
Okay, member Ghana. Okay. Okay, there's Ghana, there's Member Takile. Let me... let's ask Member Ghana to speak, and then we will be followed by Member Ghana.
Thank you very much, Chair of Chairs. I want to ask a question, follow up to the MEC, and I want to find out how many families or how many applicants for food parcels in the province are still waiting for the first deliverer to receive the first batch of food parcels across the province, the total number.
Okay, thank you very much, sir. Can I then move to Honorable Tagile?
I want to appreciate the efforts of the department as led by the MEC on the coordination that they've done with the NGO. We think that particular alliance must move beyond the question of the current situation of COVID to make sure that we have a strategic and a focused intervention. And thanks very much for that particular effort. And we think that we are on the right direction. Continue to intensify that work.
Okay, thank you very much, Titi. Can we then move to the next member who's interested to make a comment, a short comment, or ask a short question?
Thank you, Chair.
Okay,
thank you,
very
Chair.
much.
Thank you, Chair.
Who's that?
It's Beverly Badenhorst.
Okay, honorable member Badenhorst.
Thank you, Chair. Good morning, MEC.
Badenhorst.
MEC, how are you? So, MEC, my question is why do the MEC want to know how many people are there in a household? And what if everybody in that specific household is unemployed? Will you be able, MEC, to give every member of that household a food parcel? Thank you.
Okay. Thank you very much, honorable member. Can we move back to the MEC to respond to questions? And of course, if you want to make remarks on the remarks made by members, please do so, sir.
Thank you so much, Chair of Chairs. Can I proceed?
Yes, sir.
Thank you so much.
Please proceed, sir.
Thank you so much, Chair of Chairs, and thanks, members, for your questions. Member Badenhorst, government does not have a policy that checks how many people are in a household. It's the NGOs that are feeding that. Sometimes they ask for that information. We have a clear criteria of who we are funding. And I want to go through that criteria because it's very, very important that members are aware that we are not feeding for the sake of feeding and that we are not feeding purely because there's COVID, that we were feeding even before COVID. And these beneficiaries need to be protected rather than be crowded out because there's COVID and therefore they are no longer worth to be supported by government. If you take that posture, it will be wrong because the 5 key criteria that we are utilizing to feed people in Gauteng are as follows. The first group of people that we are targeting is people that are bedridden or sick on the basis that they can't take medication on an empty stomach. And that's a very important constituency that we can't ignore. We work with the Department of Health, and through their clinics and through their hospitals, they give us this information and we assist. This is to protect lives and ensure that people recover. How is a person that is bedridden that's going to look for a job or going to fend for themselves or going to get something to eat? And this is a very important and crucial constituency. Just because they can't make noise on their own, we're ignoring them and we feel that they're not important. The second group, and we've indicated, is child-headed families. Children that have been left by irresponsible parents. Children that are staying alone. And these particular children need to be protected, need to be guided, and also need to be integrated within our safety net, because it's not about the food parcel only. It's about the social work services that they need to get so that they can be put in a proper custody of a person who can take care of them and they can get a monthly grant that will protect them. It's about them going to school. It's also about them being on the line for an RDP house so that they're not permanently in an informal settlement. And this is a tangible group and they're huge. And they're very important that they're protected. And the third group are homeless people. That during COVID, we all know, when you say stay at home, where do homeless people stay? Nowhere. And therefore, we needed to remove all of them from the street so that they can be in a position to get shelter, but most importantly, they can be in a position to get a meal. And we're providing them with 3 meals per day. something that is massive, very difficult, but we've managed to execute that responsibility. And the fourth group was what we call victims of gender-based violence. That even when that man is cruel, that man must not think that the woman or the children will not survive purely because he has locked them out of the house, or he has chased them, or is threatening them with violence. It's a very important constituency that need to be given support and needed to be given guidance. And the last group then is what we call referrals, which are the referrals that we got from NGOs, churches, and other institutions. And if you check those four categories, the first four were truly protected and given the relevant support. But later on, we started to receive people who either due to COVID could not be in a position to get food. And that is why we then channeled and requested those people to apply for the 350 Rand COVID grant, because majority of them can qualify for the 350 Rand COVID grant. So that the food parcels, it's meant for the weak, the vulnerable, and the poor. And those particular people must not be crowded out. And if you check people that are saying they've not received their first tranche and other things, you might find that majority of them don't fall within these categories that I've just outlined, because these categories are crucial. But the reality is the demand is superseding what we can offer as government. We are offering 1,200 food parcels per region per month. I mean, you go to Johannesburg, if we are offering 1,200 food parcels for the people of Johannesburg a month, those food parcels are just a drop in an ocean. That is why we went back to government and said, we are creating unnecessary expectation here. Assist us to ramp up the numbers. And government has agreed now to increase it from 1,200 to 4,000. And we'll be doing so in the next 4 years. So, Membakana, as of today, we have delivered 132,000 food parcels in our province that have benefited 660,000 families. We can give you the statistics because we want each and every food parcel to be accounted for, to be recorded for. We don't want to go to a playground or a community hall and just give whoever comes a food parcel. We must track who's this person, does this person qualifies, do they have proper documents, and will they be in a position to survive on their own using other government programs so that we get them out of poverty forever. Because we don't want them to be permanently on a food parcel queue. We must empower them to be out of the food. That is why we have to know who we are giving that food parcel. And there must be proper audit, because these food parcels are for the poor. They're not for the poor. They're not for our friends or relatives. They must go to the poor. We must account who have given. That is why we can tell you now that 132,000 people have received and 660,000 people have been in a position to benefit out of this program. Yes, we can give even the numbers who have called. 166,000 people called our call center. And if you compare the number of people who have given food parcels and the number of people that they've called the call center, we've got 79.8 response rate, almost 80% response rate. And the remaining 20% is because we're overwhelmed. If we're not overwhelmed, we would have reached everyone. But with the 350,000 COVID grant, we so far have 3.9 million people that have applied. Of the 3.9 million people that have applied, over 900,000 are coming from Gauteng. Because we've been encouraging people to go for the 350 COVID grant. Because if they're a family of 4, and 4 of them get 350 each, at least it restores their dignity. They can buy whatever they want to buy, rather than us giving them tin fish, whether we are not aware they've got allergy to tin food or not. But with the 350, they can buy what they want. And they can also have the energy that they need in terms of electricity, paraffin, and other things that we are not offering. So the 80% that we have given food parcel, the 20% might get the 350 Rand. But also the fight against poverty can be reduced to food parcels. This government has a clear poverty fighting mechanisms or policies, from giving free education at higher education, giving free education at basic education, ensuring that people have a free house, an RDP house, ensuring that people have free electricity and water in every municipality. So this is a coordinated effort to fight poverty in our country. So it can't be reduced only to food parcels. If you check people that are receiving social grants in Gauteng, it's 1.9 million people at the tune of 2.3 billion. So you can't therefore portray a picture that this government is reckless in protecting the weak and the vulnerable, and this government does not care about those. And that is why we appreciate the comments made by Member Tagile as well as Member Joe Mbisi. Thank you so much, Chair. Truly appreciate it.
Thank you very much, Honorable MEC. Can we then move to the next questions? Thank you very much for responding, MEC, and thank you very much for the members who have asked questions and made follow-ups to the answers that the MEC have made. Can we then ask Member Ramolifo to read his question directed to the member of the Executive Council for Education?
Thank you, Chair of Chairs. Regarding school readiness based on phased-in approach, will the MEC please indicate what has the department done so far since the Minister for Basic Education made pronouncement about the possibility of schools reopening on the 1st of June? 2, is the MEC comfortable with the work done to date? 3, if not, what are the outstanding issues to be fixed and by when will they be fixed? 4, has the department finalized the curriculum reorganization for all grades? And 5, will the department share the checklist of all expected requirements to be met before learners return back to schools? Thank you, Chair of Chairs.
Thank you very much, Honorable Ramolifo. MEC, if you could respond, sir.
Thank you so much, Chair of Chairs. Let me thank Member Ramolifo as well for the questions. Member Ramolifo, we've taken the following posture as the Gauteng provincial government in terms of the return or the reopening of schools in Gauteng. Our call is very simple, safety first. That where there is doubt of safety, we're not going to risk our children. And in providing support for the reopening of schools, we identified 6 critical areas. The first one being the cleanliness of our schools, that all our schools must be cleaned before our children can go back to school. The minister is making an announcement in terms of the form in which learners will go back to school later this afternoon at 4. And as Gauteng, we've given the contribution. And our contribution has been placed after we've consulted organized labor, school governing bodies, private schools forum, as well as the National Department of Education itself, because we wanted to be sure that when we open our schools, will our children be safe? We wanted to be sure when we reopen our schools, will our educators be safe? Will our staff be safe? And I can politely respond in the positive, that we've put all the relevant systems to deal with this aspect. As I said, the first part was to ensure that all our schools are clean. So what we've done, we've avoided centralizing the cleanliness of our schools. For the first time, each and every school will be allocated funds in their bank account, and they will recruit local people to clean the school and forward us with a report that will indicate whether the school is clean. And on the basis of that, the Department of Health is going to assist us. That's the first component. The second component is PPEs, which you know, in the absence of PPEs, there's no way that we can risk the future for our children. And we've made a commitment as a Gauteng provincial government and as a department that each child is going to be given a set of masks every week and say every Friday. That set will include the mask, will include a face cloth, will include soap, and will also have an element of sanitizers before they enter or leave the classroom. And that is very key, because in the absence of that, then teachers will be scared to come and teach. So each and every teacher as well, we've already started distribution. All our districts are getting the PPEs, and thank you so much to the Department of Health. Each and every teacher will also have their own set of PPEs weekly, And our district offices will also get a set of PPEs weekly, and they'll be in a position to monitor. But you will see from our strategy that the district offices are going to be our operational centers. They're going to be our whole room, because they need to observe each and everything that is happening in each and every school and provide us with the relevant report. So the PPEs range from PPEs for learners, PPEs for educators, and PPEs for ground staff or people that are assisting us in our schools, as well as for educators. And the second element out of our strategy is scholar transport. Because majority of children will be using the scholar transport mode, we felt that there must be clear guidelines about the scholar transport, because this is the transport that will take our children to school, and this is the transport that will take our children back home. So in ensuring that the virus does not come to the school, the transport must be cleaned, sanitized, and the Department of Transport is assisting us. And each and every bus will have 2 bus monitors or a bus monitor who will ensure that every child that comes in, it's sanitized, and that there's social distancing, and that there's a separation of seats in the, because if you can't control it there, will not control it in the school premises. So the cleanliness of the bus will be key before it takes our children there. You will see from the announcement of the minister that there will only be 2 grades opening. So because there will only be 2 grades, we'll be in a position to manage that aspect, because it's not everyone that is coming. It's 2 grades that are coming, and therefore we'll be in a position to request them to separate in the classroom. Even when the bus comes back home, the bus must be cleaned before, so that children must not take the virus back home. And the children must be sanitized, and they must be changed so that they can be in a position to be safe by going back. So we've put those systems, and we will be in a position to control that element. The third part, which is very key now, is what we call substitute teachers. Because if you can't have standby teachers who will assist if a teacher feels is going to fall sick or is not going to meet the criteria, because our average age of our educators is between 55 and 60. And you know, that's the group that have serious limitations and serious challenges. So what we have done there thus far, we've then recruited educators and 2 teachers from the Funda Lushaka, and we are putting them as substitute teachers that will support schools that don't have any problem or that have problems, or schools that teachers that are over age are reluctant to go back to school. So we are putting that element. That's the element that we need to manage carefully. And that's the element that we are still in discussions with the teacher unions to ensure that the substitute teachers provide the kind of support. And then the next element is what we call social distancing. There have been debates and discussion that will children really ensure that there's social distancing? Yes, they will be. What we have done, we've reduced the class size from 40, which is the average number, to 20 now. So each and every classroom will have 20 learners. If we're at grade 12A, we are going to have grade 12A1, and the other class will be grade 12A2. Because we are separating the 2, you'll need more teachers. And we have costed that aspect, and we are going to be in a position to appoint teachers that will provide the relevant guidance. In particular, the teachers that are teaching grade 11 and 10, because they're still at home, we will recall them to come and supplement and assist teachers that are in grade 12. So each and every classroom, they will be marked, and each and every place within the school premises will be marked, in particular our reception area where learners tend to go to say, where can you queue and where do you stand? We are foregoing the staff rooms. Each and every teacher, 4 of them will have a classroom where they will sit rather than in the staff room, and also they will practice the necessary hygiene to ensure that we don't have infection. If we can protect the teachers, we'll be in a position to protect the learners. So our investment, therefore, is around the educators, because they are the only one who are adults that may interact with our children. And we don't want them to transfer the virus from themselves to the learners and learners to family. So we've put all the relevant system in that regard. And the last aspect of our strategy is the school nutrition itself, that all the food handlers must go for training, and they must know which food to dispose of, how to distribute food. But we are then removing the cutlery that we're using. We're bringing a new plastic cutlery so that can be destroyed immediately after being used, and all the relevant protocol of food. And learners are not going to eat at the same time, which simply means others will come at 10 o'clock, others 10:30, others at 11 o'clock, 11:30. And those that are not in the classroom, the grades that are not allowed, will then start to eat and queue after the learners there. So we have a proper strategy and a proper plan that has been supported by the SGPs and other formation. In terms of curriculum, we are letting go things that we feel are nice to have. The core component of each and every part of the curriculum will be protected. So teachers are going to teach what need to be taught, but there are other things that will let go purely because of time. So there is a team that they've trimmed our curriculum so that learners are not forced to cram work, but we can advance the components of knowledge sharing to them so that they are knowledgeable and they understand the content of the subject. But the nice to have of going out for a walk or physical training and other things, we are trimming them out and we are using the time. There are three possible options that are on the table, not for this phase, but the next phase. Either schools are going to platoon, or the learners that are going to come to school on a Monday, Wednesday, and Friday, and others will only come on a Tuesday and on a Thursday, just to manage the numbers until we are quite sure. We are changing the timetables. We are now in discussion with the principals to change the timetables so that timetables can also take into consideration the relevant things that need to be taken. So in terms of the checklist that is expected, I've got a long list. I can give it to you. It starts from the soap, the towels, and all other things that are needed so that our school environment can be safe. I want to leave it there, Chair. If needs be, I can make this document available to Member Ramlif and to members as well so that they understand what we are dealing with. Thank you so much, Chair.
Thank you very much, Honorable MEC. Member Ramulefo, you can make a follow-up question or a short remark.
Yeah, thank you, Chair of Chairs. I think what I also need is probably the interventions with regard to private transport. You did cover the, public transport which the department do provide. What about the, private transport which also transport learners to and from schools? And also maybe an update regarding schools which were touched during the lockdown period. How far are you in terms of fixing those schools, especially the ones which they were, vandalized to a point where they can't be utilized? Thank you, Chair of Chair.
Thank you very much, Member Ramolfe. Can I then request members in terms of Rule 137 in bracket 7, 134 in bracket 7, to now make any additional supplementary questions or additional remarks? Any member who's interested?
Thanks, Chair. Is Mpisi?
Yes, Member Mpisi. Another member that needs to be noted?
Member Msimanga, Chairperson.
Thank you, sir. Member Msimanga. Another one?
Member Lasindo.
Okay. Thank you very much, ma'am. Another member? Okay. Thank you, members. Can we start with Member Mpisi? Supplementary questions or comments, sir?
Yeah, no, thanks, Chair of Chairs. I think the MEC has responded to some of the areas, and Ramleford, subsequent to that, added some more questions. I will take few. Chair, there's a challenge in our rural schools, MEC. I'm not sure, because in the past we had an issue of
Member Mpisi, are you having challenges of connectivity?
Somebody is just muting me, Chair.
Oh, okay.
Yeah, I don't know why, but why they're doing that. But Soli, can you switch off your? Thank you very much. No, Chair, I was saying that the rural schools in our province have challenges of ablution facilities and water. And in some areas, you can't pump water from the ground because they're in the uphill area. Second one is the issue of the number of schools that were damaged in the province. Are they ready to accept the reopening of the schools during this period? And how many schools are there? And what is the process? My worry, Chair, is the issue that if we are not careful, that we have seen in Europe and Asia, that schools were reopened and the number of COVID-19 in those schools increased. And what measures are we putting in place, MEC, besides the one that we have already mentioned? Lastly, is the issue of the teacher unions. Are they in agreement now with the department that they will go to school, they will go back to school, particularly members of SATU, to make sure that they teach during this difficult period? Thank you very much.
Very much, MEC. Member MPC, can we then move to Honorable Member Simang?
Thank you very much, Madam. Thank you very much, Chair. I am covered adequately by Member MPC.
Thank you very much, sir. Can we move to Member Lindiwe Sindwa?
Thank you very much, Chairperson of Committees. And let me take this opportunity and thank the MEC for the detailed plan for the schools reopening. However, I only have two concerns, Chair, which I'd like the MEC to respond to. It's in relation to the scholar transport users. You have learners who are staying far away from school who are using the scholar transport. What will happen if the schools, others are living at 11, others are living at 1 in terms of the transport? The second one will be in terms of the grades. In one family, you find that there are 3 children who are in the same school. So if the others are living at 11, the others at 3, what will happen to that? So my major concern is in relation with the learners who are using scholar transport during this period. Thank you, Chair.
Thank you very much, members, for your questions. Can you then allow the MEC to respond?
Can I come in, Chair?
Chair, have you forgotten me?
No. You never indicated your interest to make follow-ups. Can I then allow the MEC to respond, please?
Is not waiting when I do it.
Chair, we have noted me, Member Takile.
I never noted you, Member Tagil. The last person to know you are totally.
Thanks, Geoff. And thanks, members, for the questions. Member Lasinda, where we are now, we don't think that we'll have problems of transport leaving early in the morning and in the afternoon for other learners, because we're only taking grade 12 and grade 7s. So those 2 grades will have separate transport to take them. We have procured 1,100 buses to take care of our children. So there won't be that problem, even if they're in different grades. This is phase 1. When we come to the next phase of bringing other grades, we'll formulate a new strategy and we'll share with you and to clarify. But I can assure you, the scholar transport arrangements are in place, and there will be no learner that will be disadvantaged, whether they're staying far or not, and all of them will be given the relevant support. If I have to move to Member Jombi's, yes, we've got 167 schools that have challenges of water and sanitation, together with the Department of Human Settlement as well as the National Department of Water. They've been providing us with the relevant support that will be needed. So we'll procure some interim water tanks. It does not mean we don't have water. It's that the pressures of water in those communities are so low that it might create problems. But there is a backup facility that we are putting. There are also 67 schools that has fencing challenges, which simply means there's no fence at the school. And we know that we don't want people just to cross our schools uninvited, and people that we don't know to mingle with our children. So we are also moving with speed to ensure that this is rectified as soon as possible. Indeed, the proposal that we are sharing with you, we've worked with teacher unions, including SATU, with bilaterals with SATU. We're going back to them on the 29th with our final readiness plan. But the plan that we have thus far is a joint program. It's not our program alone as the department. And then we're working with them. So on the 29th, we'll have the final approvals that we need so that the schools can start on the 1st of June. In terms of vandalized schools, all those schools that were vandalized, what we've done, because the majority of them, they vandalized that main block, what we've done, we've moved that bin block into the classrooms, and we've procured mobile classrooms that can be used when we need classes. But the admin part will now be in the classrooms, because you can't put admin capability in a mobile classroom because it can be easily broken into. So indeed, we've received mobile classroom. Just because we are at level 4 in terms of our regulations under the Disaster Act, construction is not allowed. So we could not rebuild those classrooms. So we are now using other classrooms that were not vandalized, the staff room, and we've brought the mobile classrooms to deal with that aspect. Memorably, for the private transport, you are right. We are meeting with the private transport. There's a team guided by the Department of Transport. There's an organization that represents private transport. And they themselves, they've committed that they will adhere to social distancing, they're not going to overload their cars, and that there will be sanitization, that a learner without a mask will not be allowed in the Kumbi. So we are also working with the private transport institutions. I don't want to politicize this matter, Chair of Chair. I will raise it in the political forum that the Premier has indicated that we are working very closely with the leadership of other political parties. But yesterday, Chair, people wearing EFF T-shirts have been turning back the service providers that are delivering PPEs in our schools. In particular in Tutuza, we have to distribute these PPEs at the police station in Tsakani, because these people are blocking our service providers to deliver PPEs in our schools. We don't know indeed they belong to that organization, and that is why I say we don't want to politicize it. We'll raise it formally with the said political party in the meeting with the Premier, because if they block people to deliver PPEs, they're literally putting the lives of our children at risk, because these are the PPEs that our children need. And I hope the political party concerned will also investigate this matter and work with us to ensure that these people are not given an opportunity to disrupt schooling. Thank you so much, Chair. Truly appreciate it.
Okay. Thank you very much, Honorable ABC. We don't have enough time for questions, so can we move to the next question? And the person to ask the question is Member Ghana, and the question is directed to MEC, Economic Development, Environment. Please, Member Ghana, can you ask your question, sir?
Thanks very much, Chair of Chairs. Regarding the COVID-19 relief to small businesses, spaza shops, and informal traders, could the MEC please indicate how much in rents and cents has been set aside to assist small businesses, spaza shops, and informal traders? How many recipients will be reached by this intervention? Number 3, what is the criteria for requesting assistance? And finally, how many have applied and how many have been assisted thus far? Thanks very much, Chair of Chair.
Much, Honorable Ghana. Can you then request Honorable MEC responsible for Musupia, who is responsible for economic development, environment, and agriculture and rural development?
Okay.
Honorable Musupia.
Thank you very much, Honorable Chair of Chairs, and thank you to Member Ghana for the questions. And in response, I think it's important that the Honorable Member should note that at the core of Gauteng's economic response is the objective to cushion the SMMEs against the impact of COVID-19 on township economies, and that within this context, Gauteng Enterprise Propeller has reprioritized about 40 million rands for its limited resources to be utilized for small enterprise relief and support to spaza shops, informal businesses, salons, and small-scale manufacturers. Debt relief mechanisms will also include a 6 months payment holiday for the entity's clients in good standing. On the other hand, Honorable Ghana, Gauteng Enterprise Propeller is currently working with the Department of Small Business Development to coordinate an integrated COVID-19 disaster management and post-COVID-19 economic recovery approach. The DSBD Spaza Shop Support Scheme has an allocation of 37 million rands, and the entity aims to play a critical role in preparing Gauteng small businesses to access the funding allocated for supporting Gauteng Spaza shops. In addition to this, together with the Office of the Premier, we are exploring other initiatives that will be prioritized through the revised budget of the province. In relation to question 2, Honorable Member Ghana, the entity support is targeted to benefit about 4,000 beneficiaries across the Gauteng City region, and that support will include business development support and grant funding for SMMEs, cooperatives, and informal businesses. In relation to question 3 on criteria, the answer is that the SMMEs must be Gauteng-based enterprises. Compliance document must also be valid from these SMMEs. Beneficiaries to the predominantly township-based enterprises, and the small-scale manufacturers for manufacturing support interventions. And lastly, in the criteria is that enterprises must be operational, and they must have been operational for at least 12 months before they benefit from this. In relation to the last question, Honorable Ghana, the entity has received 247 new applications for the period from the 1st of April 2020 to the 13th of May this year still, from small businesses across the province, and 144 of those sought financial support and 103 sought non-financial support. And all of these are currently being assessed to be prioritized for the COVID-19 relief interventions. In addition to the prioritization of current financial year budget allocations to align with the COVID-19 dynamics, the entity is currently re-engineering its processes with a view to fast-track the processing of applications and enhance its overall responsiveness beyond the pandemic. I thank you very much, Madam Chair of Chairs.
Thank you very much, Honorable MEC. Can I then request Member Ghana to make a supplementary, to ask a supplementary question or make a short remark?
Thanks very much. Thanks very much, Chair of Chairs. As a follow-up, what has convinced the department that the GEP that is known to be underperforming will be able to do this task, and whether that 4,000 is inclusive of businesses, spaza shop, and informal traders? Is it a combined figure, or is 4,000 of each sector? Thanks very much.
Very much, Honorable Member. Ghana, can I then, in terms of Rule 134 in bracket 7, now open for additional supplementary questions or additional remarks by members? Any members interested to speak? Please indicate your name, please. I can't see hands, unfortunately, from my system. That's why I request that people must indicate by voice, but please tell me what's your name. Any takers? Who's that? Please indicate your name. Oh, okay. Thank you very much. There's a female voice. Which member wants to speak?
It was Member De Lange.
Yes, Member De Lange, you can ask a question, ma'am.
Thank you, Madam. I just want to ask the MEC, the selection criteria for small businesses that will receive assistance, financial assistance, will it be across the racial border, or is it just going to be in the informal areas?
Okay, thank you very much, Honorable Member.
PC, Chair.
Honorable John PC?
No, Chair, I think the MEC has explained very well in her response. But I don't think the department, is just a comment, I don't think the department will distribute or assist small businesses according to their race or gender. I think Member De Lange must desist that, because it is a narrative that is not allowed, I think, in as much as they hold their own view as the Freedom Front Plus, but I don't think
point of order.
It's correct. It's
Chair, point of order.
The government of
What
Gauteng
is
helping.
Let keep quiet.
Point of order,
Can
Chairperson.
you please? Yes. What's the point of order, Member Msima?
Chairperson, I think it's prudent that we allow the MEC to respond. Member MPC should not preempt what MEC is going to say. Thank you very much.
Point of order. I'm making a comment.
Chair of Chairs, point of order. Point of order, Chair of Chairs.
Okay. What's the point of order? What's the point of order, Member Makubela?
We must not allow Honorable Nsimanga to direct this meeting without telling us which point of order is he rising on. He can't preside over the meeting. You are the presiding officer. You are presiding over this meeting, please.
Yeah, but you have done the same mistake, Member Makubela.
Can I continue, Chair?
Yeah. Okay, fine. Member Mpisi,
yes,
can I
sir.
request that you focus on your own?
No, I said I want to make a comment, Chair, which I think is linked
make
to
your
what...
comment and
yeah,
make a comment and let us move to the next.
Thank you very much. And I think, Comrade Honorable Msimang must be patient because the issue is that you see, if we are going to use the race or gender, whether it's the working class or liberals in our statements, I don't think it will help us as a province. And I think, taking from what the Premier said this morning, I think we must desist from using whether things are given only to blacks, not to the white people. I don't think it's right. We are non-racial South Africa, and we should continue like that. Thank you very much.
Madam Chair of Chairs, point of order. Point of order.
Yes, Member Moriarty.
Thank you very much. I'd like to read Rule 134, subsection 7. It says that at the discretion of the presiding officer, any member may ask an additional supplementary question or make an additional remark, and these are the key words here, related to the original question or reply, i.e. what did the MEC say? Now, unfortunately for Honourable PC, he's reacting beyond the remit of this particular order. He's replying to De Lange. He should be making his remark in respect of something said by the MEC. Thank you.
I don't agree with you, Mike.
Member Mpisi, I'm the only one who can respond to what the honourable member have just said. Can we then focus on the questions that have been asked by members, because that's what the rules are saying? If we are not focusing on them, then please let us keep quiet. Can we then move to the MEC to respond to questions? Honourable MEC, do you want to respond, ma'am?
Yeah, no, I'll respond to the 3 questions. Let me start with questions from Member Ghana. Yes, I think the first question is a straightforward response. Yes, the 4,000 does include all sectors. It's inclusive of all sectors. And his first question, whether I am convinced that the enterprise has capacity to respond. Yes, the entity has got its problems, but there's evidence that, yeah, they have been able to do their work. And if Member Ghana is interested in getting information, more information of how many members we have, members across the board we have reached, I can make that information available to him, or alternatively, he can bring it as a new question. On Member Dilange's question or response, Honorable Chair of Chairs, I'm inclined to agree with Member Mpisi. It's unfortunate that Member Dilange chooses to racialize such a sensitive matter. And I don't think he or she had time to really think through her question through. And I would advise her to please be sensitive to people who need this kind of assistance and not unnecessarily racialize things. It's just unfortunate, really. Thank you, Chair of Chairs.
Point of order, please, ma'am.
Thank you very much, Honorable MEC. Can we then move to the next question?
Point of order. Point of order, please.
Who are you? Who are you?
It's Member De Lange.
Yes, Member De Lange. I requested that because I can't see hands. My system is not allowing me to recognize hands. Please indicate your name first before you make a comment.
Thank you. It's Member De Lange.
What you are? Okay.
On which rule, Chair of Chairs?
Please just clarify here.
On which rule
you know,
is she coming in, Chair?
Please indicate. Now, Member MPC, I will handle this. Please indicate which rule you want to speak on.
Nobody is called to any rules.
Can we then move? Okay. Can we move to the next order, please? Can we then ask Member Shackleton to ask questions directed to MEC Community Safety?
Thank you, Madam Chair of Chairs. Through you to the MEC for Community Safety. Regarding arrests since the commencement of the lockdown period, could the MEC please indicate, 1, how many arrests have there been to date for violation of the lockdown regulations? 2, how many of those in 1 have been taken to court? 3, how many of those in 2 have been convicted? 4, what was the sentence in 3? And 5, how many unlawful arrests have there been in this period, and has action been taken against the officers involved? Thank you, Madam Chair of Chairs.
Thank you very much. Honorable MEC Mazibuko, please respond to questions.
Thank you very much, Honorable Chair, Chair of Chairs and Presiding Officer. With regards to question number 1, on how many arrests have been made since for violation of the lockdown regulations, the total number is 38,698. How many of those have been taken to court? The answer is 25,279 of them have been taken to court. And how many of those have been convicted? A total of 1,387. Others, their court dates were actually postponed to a later date because, as you know, courts are not necessarily sitting, and as a result, they have to turn away people. On question number 5, how many unlawful arrests have been during this period? The answer is there is no record of any unlawful arrest that has been received so far. Thank you very much, Chair of Chairs.
Very much, Honorable MEC Mazibuko. Can I then check with Honorable Shackleton if he's got follow-up questions or any comments?
Thank you, Madam Chair of Chairs. Okay, if I may proceed, I'd like to ask, if the police have received training in terms of implementing the lockdown regulations so as to mitigate against unlawful arrests or illegal actions taking place?
Okay, thank you very much, sir.
Chair of Chairs, Member Ntsehe.
Member Ntsehe, I think sometimes we need to also understand. Yeah, you can't keep on shouting when we are following a proper procedure here, ma'am, right? Can I then ask members in terms of Rule 134, subsection 7, to ask additional supplementary question or additional remarks? Any member that is interested to ask a question, Please indicate.
I'd like to indicate Chair of Chair.
Thank you. You are noted, ma'am. Any other member? Any other member? Going once, twice. No one. Member Ntseke, please ask your question or make a remark, ma'am.
I'd like to make a remark, Chair of Chairs. I just want to say 2 Sundays ago in the observatory, a mother with a baby on her back was arrested when she was about to enter her house, and she went into the police station cells in Yeovil, and she literally had plastic bags in her hand. And I think it's important, MEC, that you cannot have a mom with a child spending a night in a police cell with a young child on her back. That for me is police brutality of the highest order. Thank you very much.
Thank you very much, Member Ntseke. Honorable Member Mazibuko, can you please respond to the question, supplementary questions and comments?
Thank you very much, Chair of Chairs, for the opportunity. On the response question by Member Shackleton on if police have received any training, obviously there can't be any training this time of the year. They use regulations, including subsequent declarations that are also made by Chief Justice on how to use the various means, like how to find people like your J534, the J46, because some of the cases are not necessarily those that may require them to be taken to court, but the over-the-counter bail does apply. And on the question from Member Ntseke is that, as far as I know, no police officer is allowed to arrest a baby, a woman with a baby. If they have to place that woman under arrest, they have to make arrangements that the child is actually removed. No child goes to a cell. If she has those allegations, can she kindly indicate to us when was that, the date, so that then we're able to make a follow-up to the Yeovil police station. But as far as we know, we don't have such a case that has been reported in, especially because we've got monitors and those that are part and parcel of the CPR that make sure that all these stations are observed. Thank you very much.
Thank you very much, Honorable Member Mazibuko. Can we then move to the next question? The next question, I think it's is a question by Honorable Member Paladi Dikhamela, and the question is directed to the member of the Executive Council, MEC Masuku. To Member Dikhamela, can you please read your question, ma'am?
Thank you very much, Honorable Chair of Chairs. Regarding traditional medicine, can the MEC please indicate what is the role of traditional medicine during the COVID-19 pandemic, with specific reference to Mhlonyana or Lengana, also known as Artemisia? Thank you, Honorable Chair of Chairs.
Okay. Thank you very much, Honorable Dikhamela. Can we then request our Honorable MEC to respond to the question? Honorable Masugu.
Yeah, well, thank you, Chairs of Chairs, and thank you for the question, Honorable Member Dikhamela. I just wanted to indicate that we, as a form of a background, that we had an engagement with our formal structure of traditional health practitioners in the province. And we also invited those who represent the sector in the Gauteng AIDS Council. So we have formalized a working stream within our public health response, which we would be following up with a whole lot of programs on the ground, being active with them. But the first step that we were trying to do was trying to deal with the issues of regulation and their involvement around the fight of the pandemic, which they've been doing in the last 2 weeks or so. So we actually say that we acknowledge and appreciate the role that they play in the whole fight, because we know that 70% of our people in the country, the first people that they go to in terms of consulting are traditional health, healers. So in the question that you have asked about Lengana, we know that Lengana or Umhlonyane has been used since time immemorial in the country to deal with symptoms that are related to your flu or your cold, and also symptoms that are related to your gastroenteritis or gastro problems like constipation, and it also used for other use in that regard. So it has been one of the medicines that have been widely used in our country and have been used. The only thing that we need to say openly and clearly is that in terms of symptoms, yes, it does have an effect, but it doesn't cure or kill the virus. And we did some of the work also in conjunction with what we're reading in terms of the quarantine and isolation facilities in China, that they also utilized a whole lot of Chinese traditional herbs in making sure that the symptoms of the patients that they were having in isolation was used. So we are in the process of also verifying with the University of Johannesburg faculty which deals with medicines to try and get what extra other effect does Lengana or Mohlonyane have in the fight against what we are seeing as COVID-19. But in terms of the symptoms, it's a known established fact that it does deal with those symptoms of fever and coughing and sore throat. So that's what we've been doing with the traditional medicine, and we're waiting for the outcomes of that small investigation or research that is done by UJ. And we have also been approached by different individuals across the province who also have got some concoction or so, which we also have referred them to the UJ faculty on health sciences, and we're waiting for their efficacy. So basically we are doing that role, and they are also going to help us firstly to do the triaging of patients, also to create public health education in terms of the hygiene that we're talking about, and also to make sure that they educate their patients in terms of counseling and other things. And they also agreed in principle that they will help us to postpone most of their ceremonies, which is a good gesture from their side. You know that they normally do have graduation ceremonies where Amathwasana Ikaya, and they also agreed that the initiation schools, which we don't have many in Gauteng, would be deferred. So indeed, we are engaging with the sector with an open mind of not integration, but of inclusion, including them in a broader public health system. Thank you.
Thank you very much, Honorable MEC. Can I then ask a member, Paladi Khamela, to ask a supplementary question or make a short remark? Member Dikhamela.
Thank you very much, Honorable Chair of Chairs. Thank you. It's a short remark. Thank you, Honorable MEC. There are many people who are contacting us regarding what they know, and I think your response is very assisting. We will get details of the meeting where these people are meeting. Then we can refer them there so that they follow the proper channels. Thank you very much.
Okay, thank you very much, Honorable Member Dikhamela. In terms of Rule 134, subsection 7, I now open for additional supplementary questions for members. But also before opening up for members to make comments, can I request members not to use the opportunity to make this opportunity to make to ask questions or debate amongst yourself, but also try and avoid to smuggle in issues that are not relevant to the issue at hand. Can I check if members want to ask supplementary questions or make a remark? Honourable members? Going once, twice. Thank you very much. MEC, do you want to respond to the comment?
No, we do welcome every contribution, but remember, we also have to formally look at how the inclusion of indigenous knowledge system, particularly in traditional medicine, will be included in the public health sector. And it's a one way that we are going to make sure that it becomes a holistic sector that deals with everyone and create a better access. And I think this is just COVID is making it possible to fast track some of those reforms. Thank you.
Thank you very much. The speaker is around, so she'll take over from now. Thank you very much, MEC. Speaker.
Thank you very much, Chair of Chairs. Can I call upon Honorable Macheke to ask his question to MEC for Sports, Arts, Culture, Education?
Thank you, Honorable Speaker. On a number of occasions, the MEC and Premier have both indicated that the priorities of the sixth administration with regard to sport development will be on infrastructure development in Gauteng. Can the MEC please indicate the following? What is the plan of the department with regard to the following sport infrastructure programs? And if there's been budget allocation provision made, please indicate rents and cents for each project. The demolition and construction of HMP Chess Stadium in Mamelodi, Tshwane, the completion and operationalization of Operation Mabaling project in Westbury, Johannesburg, the refurbishment of Bofandrenen Stadium in Krugersdorp, West Rand, and the refurbishment of Patrick Esentsweleng Stadium in Mohlaken in the West Rand. Thank you, Speaker.
MEC.
Thank you, Speaker. And thank you to Member Macheke, and good afternoon now to everybody. With regard to the first question, a feasibility study and a complete business case has been finalized and submitted to the Gauteng Provincial Treasury for consideration. The above business case, the council resolutions, and the feasibility study have also been submitted to DID for activation of the project. The department continues to engage with DID on the project, and I must just indicate that some of this progress has been derailed with regard to the COVID-19 pandemic and the resultant lockdown that has taken place, but those engagements are resuming. And just to also indicate that the GPT, which is the Gauteng Provincial Treasury, will revise the budget and allocation for the demolition, and once the implementation plans have been finalized, it will be submitted accordingly. With regard to Operation Mabaling project in Westbury, it is 99% in completion, and to date, it is envisaged that we will conclude within this financial year. The budget allocation for the financial year 2020 to 2021 is 500,000 for the finalization, and this will go towards things such as lighting, upgrading of the current fencing, providing additional ablution facilities and change rooms, etc. These are some of the things that the communities had raised when we had engaged with them. So that is what that budget is going to go towards with regard to that one. And then on the third and the fourth question with regard to the Bob van Renen Stadium in Krugersdorp and the Patrick Esentsweleng Stadium in Mohlaking, these are reflected on the departmental 5-year strategic plans, and the department will be securing funding for the feasibility study through our budget adjustment process. Thank you, Speaker.
Thank you, members. I'm only going to allow Honorable Macheke to ask a supplementary question because we have run out of time for this particular session. So I'm going to use Rule 134, Sub 7. Honorable Macheke, do you have a supplementary question?
Yes, Madam Speaker, it's a comment, in fact. Earlier, the Premier, in his response, Madam Speaker and MEC, to Member Msimanga, indicated that all departments will be expected to reprioritize their APPs and the budgets due to the COVID-19 pandemic. And some of the focus areas will be on infrastructure development. It's important that sports infrastructure is also looked at as a tool to promote healthy lifestyle, because the National Institute for Communicable Diseases indicated that the majority of deaths in South Africa are due to underlying comorbidities like hypertension and others. And we all know that the healthy body, through participating in sports, can assist in managing some of these illnesses. Therefore, MEC can, during the adjustment, as you've indicated, the department look at prioritizing and allocating funds to sports infrastructure, especially from savings made from events that were planned by the department during the first and second quarter. As some of these infrastructure projects don't need huge amounts of money, much as we understand the budget constraints of the department. Thank you, Madam Speaker.
Thank you. Honorable MEC.
Thank you, Madam Speaker, and we fully agree with the comments that were made, particularly because we all know that the department and the sectors that it serves are one of those that are highly affected. So part of the focus for the department will definitely be on infrastructure, and he correctly indicates that in this regard, as we realign, a lot of the budget and our focus for the department will be on the infrastructure, especially because we want to get ourselves ready for some of the programs that we were supposed to roll out, but we now can't. And this goes, for example, for the Wednesday leagues. So we will be putting a number of the infrastructure in place, and some of it will go towards the schools accordingly in line with the objectives that we had, so that when we start the rollout for programs such as the Wednesday leagues, we are ready and infrastructure is in place. But thank you so much for the comment.
Thank you, MEC. Next question, Honorable Macheke to MEC for COGTA and Human Settlement.
Thank you, Madam Speaker. During the 2016, the Mogale City local municipality announced that as part of their human settlement development, they will be prioritizing the formalization and electrification of informal settlements in Mogale City. Can the MEC therefore respond to the following? How many informal settlements in Mogale City have been formalized and electrified? How much in rents and cents was spent in each? With regard to the question above, could the MEC indicate if Orient Hills informal settlement is part of the above? And if not, why does it take so long for the formalization and electrification of the Orient Hills informal settlements in Magaliesburg by Mogale City local municipality, considering that this informal settlement is one of the oldest informal settlements in Mogale City? Thank you, Madam Speaker.
Thank you. Honorable MEC.
Thank you very much, Honorable Speaker, and thanks to the Honorable Member for the question. The answer to question 1 is as follows. In 2017, Mogale City local municipality submitted to the province the list of 19 informal settlements to be considered for funding and upgrading. The 19 submitted informal settlements included Orient Hills informal settlement. The program has not yet been funded. In terms of electrification of informal settlements, ESCOM electrification program, in fact, it's ESCOM that is responsible for the electrification program for informal settlements. Mogale City initially submitted 20 informal settlements for consideration of this electrification program. However, priority was given to all informal settlements residing on located on state-owned properties. It was during the implementation wherein occupiers of privately owned properties made representations that they too should be considered for electrification program. ESCOM subsequently approved such a electrification program on privately owned properties, pending consent from the owners of those properties. So Orient Hills informal settlement was then considered for electrification under the financial year 2020/21 to date, and ESCOM has electrified 11 of these informal settlements and 4 are still under construction. On question 2, more than 46 million has been spent on upgrading and electrification program of the informal settlements in Mogale City Local Municipality. And funding for this came from both the provincial government and ESCOM. On question 3, yes, Orient Hill is part of the program, as I've alluded earlier on. And on question 4, in terms of electrification, Orient Hill is one of the settlements that are in the private properties, and ESCOM has included in their plans for areas to be electrified in the 2020-2021 financial year. Thank you very much, Madam Speaker.
I did not hear that, Honorable Speaker.
You did not hear the response?
No, I'm saying, can I speak? Because I did not hear you when you
Yes,
were speaking.
I said you can now have your supplementary question or comment.
It's a comment, Honorable Speaker, and thank you very much, MEC, for the response. I'm quite happy with the response. Ultimately, the people of Orient Hills will also have electricity. I'm very happy with the response. Thank you so much.
Chairman, Member Soroti, may I pose a question, please?
Took more than 60 minutes. Yeah. MEC, do you want to make comments?
No, except that Member Sirota can call me. I'll answer his question. Thank you.
Postponement to the speaker. We now request the MEC for Social Development to explain why he failed to respond on time. Honorable Lissufi. Honorable MEC Lissufi. We are the acting MEC for Social Development.
Madam Speaker.
It does look, yeah, please, can you explain why you did not submit your questions or requested the speaker to allow you to for extension?
Thank you so much, Madam Speaker.
Don't respond to the questions.
Thank you so much, Madam Speaker, for the opportunity. I checked with the leadership of the department to check what caused all this unnecessary delay. I've since been given the answers, Madam Speaker, and those answers will be taken to the members that have asked them. It's just mainly administrative backlog on the basis of staff members not being in the office, and also the areas where this information was requested, people were on lockdown and we could not get the relevant information. We truly apologize, and the questions have been answered now because everyone is back, and I've made them en route to our office, Madam Speaker. Apologies, Madam Speaker.
Okay. Thank you, MEC, but next time if you are late, please just indicate to the office of the speaker that you are running late, then we'll grant you permission for extension. Those questions, those responses must not go direct to members, but they must come to proceedings. Therefore, they'll be en route to those members. Thank you very much.
Speaker.
Colleagues, we have come to the end of our meeting. Thank you very much for your participation. We could not, because of the disturbances earlier on, even welcome a new member, Honorable Peach. You're welcome. Our next meeting will be on the 2nd of June at 10 hours sharp. Thank you very much. The meeting is adjourned.
Thanks, Speaker. Siyabonga.